Okay, everybody. So we are going to be talking about allergies, and then there is a part where we're talking about emotional responses. Actually, one of the things that we kind of pulled together for this was that the lower emotions aren't necessarily something separate from allergies. A lot of times when you have this agitated portion of the immune response, it generates a bunch of just kind of emotional responses. They're not really emotions that are tied to thoughts or feelings. They're just things that kind of get triggered, or they're states that you get kind of stuck in, and they're hard to break out of sometime. So we kind of wanted to do a 1-2 punch on the whole front of allergies. The most common emotional response for allergies is anger. When somebody has really severe allergies, especially to things like sulfites and things like that, the byproduct of this is to just have these bouts of anger that really kind of don't make any sense. They don't really reflect anything other than you're just kind of in this agitated state. And so if you think about it, your immune system is in charge of keeping out outside invaders. An allergic response starts to become when your immune system is starting to become kind of hypervigilant of sorts. And so, like say you get a bug bite or something, or you get an injury, your body sends more blood to the area to help that heal faster. But after a short amount of time, it becomes, stagnant or inflamed, swollen. And so sometimes these responses are counterproductive. And so we want to go through and look at the allergic response. So what happens over a period of time is this is not something that's like content driven. It's not like, oh, this person did this person did that, this external thing happened. We're dealing with just a state of agitation. The immune system gets agitated, and then it gets agitated, and then it gets agitated, and then it gets agitated. And then pretty soon what starts to happen is it just stays in this agitated state. So that means your physiological functions get impacted, but also it starts to produce emotion. Remember that your body is constantly generating emotion for you to take action in the environment, right? So a lot of times these lower emotions are byproducts of partially of immune function. And so with that, we want to be able to go through and unwind the allergic response, and we want to unwind the effect of the allergic response being super agitated for periods of time. So think of it as just like a hypersensitivity or a hypervigilance. The immune system becomes hypervigilant. And with that, we're going to talk about some things that aren't necessarily thought about, at least in the American medical approach to allergies. Food sensitivities, I would actually a lot of times fold into allergies, just because a lot of times what we're talking about is either like toxicity in the gut, meaning poor lymphatic movement, or we're talking about poor nerve innervation into the gut. Over a period of time, if this is treated properly, food sensitivities will go away. There are exceptions, but usually they're tied to a particular condition, not just food sensitivities. There's usually some sort of medical issue that is causing the food sensitivity. So with that, also medications can cause food sensitivities, by the way. And so we want to go through, and we're going to kind of look a little bit at all of this and give you some long-term strategies and how to go through and do this. Now, the thing that we have to take into account is this is not just, I'm going to take a pill and this is going to go away. You're reconditioning the body. the idea that we can take a pill and just have something go away, even when you're using something that's like an over-the-counter allergy medicine and some sort of an antihistamine, you're just giving the body a temporary state of not being in that allergic response. You really haven't changed the body by taking that. So we're not really looking at this from a point of view of, I want to take this for, my hay fever. I want to be able to take this. We do want to manage that somewhat, but at the same time, we want to prevent that we just get hay fever. We want to prevent that we have an allergic response. An allergic response is always on the table. Like your body always has the potential for an allergic response, but we want to reduce the agitation in the body so that, say you have allergy-induced asthma, that the asthma actually greatly reduces and actually goes away. You can possibly even get off your medication. There's been lots of times where I've treated people with allergy-induced asthma where we've got them off their medication a lot of times in 30 days. I mean, it's not something that is this big, prolonged treatment. Still, I would say if you have chronic allergies, think big picture. Think of it as chess, not checkers. You're looking at treating this over a long period of time and reducing it and keeping it reduced. There's going to be times where the body is calm and then the allergic response is going to become agitated and come up, and then it's going to go away for a little bit and then it's going to come up. So if you treat this over a long period of time, every time it starts to come up, you're already knocking it down. And so pretty soon what happens over a period of time is you just stop having those agitated allergic responses. It doesn't mean that it still couldn't happen. Of course it could still happen, but we want to reduce how often it happens and the intensity of what happens when the allergic response happens. So with that, and this includes food sensitivities, there's no reason that there should be an immune response when you ingest food. No reason, right? If that's the case, we have to look at all of these factors. It usually is a poor nerve innervation for food sensitivities, by the way, almost always. Sometimes it's a toxic gut. So when we're looking at allergies, even if it's in the gut, we're still looking at the same mechanisms. You're looking at the skin, you're looking at the respiratory tract, you're looking at the digestive tract, you're looking at lymphatic function, and you're looking actually at the diaphragm. And the diaphragm is an interesting thing. So for one, if the diaphragm is tight, one of the things that happens is it compresses lymphatic vessels and kind of makes the gut relatively toxic. And so a lot of times if you unwind the diaphragm, there's been several cases where the allergies have gone away or the food sensitivities. For example, people who have had diarrhea for long periods of time. I mean, there's people who have had diarrhea for years and years and years. I mean, every day. And, they're not responding to medications. They're not responding to normal treatments. And then we go through and we unwind the diaphragm and all of a sudden the diarrhea stops, So one, that is toxicity in the gut. They're not able to basically take out the lymphatic garbage. The lymphatic system is not able to fully function. And two, your diaphragm is very, very closely related and dictates some of your autonomic nervous system functions. And so when the diaphragm is really tight, the nervous system, the involuntary part of your nervous system is thrown off quite a bit. And part of what moves your gut is your involuntary nervous system. And so it's agitated, it's in fight flight, it's not in rest and repair, it's in some variation of that, it's not shifting like it should. And so a lot of times it's not about just that there's muscle tension in the diaphragm, there's a neurological component to it that needs to be addressed. We've been doing this a lot in a lot of the other classes, but here we're going to pull everything together so that we can look at it from the point of view of the allergic response and food sensitivities. So with that, let's start with just a super agitated allergic response. Now, the thing that you have to keep in mind, we're not doing this from just a medical point of view. We're doing this from the point of view of your physiology, your psychology, and even an esoteric component, right? Everything that we do is always based on all three of these. So when we go through and we look at this, part of your immune response, part of your allergic response is actually tied to your will, right? Because again, it's about keeping out outside invaders, viruses, bacteria, things like this. And so when lower aspects of the will are excessively activated, part of what happens is it affects your immune system. And so sometimes I opened up a can of worms. Like say you go to a work and there's just this one person who's an ass. Like, let's just call it what it is. They're an ass. They're aggressive. They're insulting. They're whatever. Super agitated immune system. It's exactly what it is. Don't get me wrong. They have the personality too, but the personality impacts the immune system. And it's hard to say, but possibly, maybe from a young age, the immune system got super agitated and that started to affect their personality. And so, one of the things that you can look at is like, okay, are there times when I get excessively, aggressive or willful or, something of that way? And I mean willful, like in a negative way. Everybody is willful, but we want it to be more of the refined aspects of the will, not the lower, like the real low drives. And so when we go through and we are addressing allergic responses, in a way, we're also refining the will somewhat. We're softening the will. We're making it more about the mental will. We're making it more about the spiritual will. And so in the business setting and the corporate setting, immune issues are very, very common. In severe trauma cases, the immune system gets really thrown out of whack. Not necessarily overagitated, sometimes depleted and like low function. And so if you look at somebody that's like from a shooting or bombing situation, the mass shootings or bombings, within a short amount of time, they actually start to have immune issues. This happens also with vets coming back from Afghanistan and Iraq. Poor immune function. And so this can be a period of time where the immune system was super, super agitated. They were really dealing with potential external, harm coming their way. And then at some point, the immune system is just exhausted. So we want to look at several things. This isn't completely about the immune system. This is really more about the allergic response. But we're going to be putting things under the microscope at some point and then going a little bit big picture. It kind of depends sometimes with a class like this, how the class rolls out. But it's not a cookie cutter approach when you're dealing with the immune system, the nervous system, the endocrine system. You really have to be able to treat and evaluate, because it's not always the same, because there is multiple causes for what is going on. Another good example of this is blood pressure. So many causes can be causing blood pressure to go up that there's not really a cookie cutter approach of like, oh, if you take this makes your blood pressure go down. You might use something that works for your blood pressure for 3 months and then it stops working. It's because it's tied to how your body is adapting to other things going on. And so Western medicine is really good at treating some things. Like if you have a cardiovascular issue, Western medicine rocks. If you have a broken bone, it rocks. I mean, there's things that it does really, really well. But when it comes down to functional issues, it's good, but sometimes other approaches are needed. The idea of just a symptom-oriented approach doesn't really allow for you to have strategic ways of preventing and changing the body and the physiology. And then to take it a step further, tying together the physiological issues along with the psychological issues or the emotional responses. I mean, that's not even on the table. And so the only time that I've seen that on the table is allergies to sulfites. Western medicine does acknowledge that it produces large amounts of anger. And so, say you like your wine or something, but you notice all of a sudden your emotions are getting pretty high. Or the other source of sulfites is dried fruit. Say you're eating a lot of dried fruit and all of a sudden you're having, anger outbursts. It's not that you have issues with people around you. Your body's having an issue with the sulfites. And so if you go through and you treat the allergic response, you can actually keep enjoying the food or the wine or whatever it is, and the anger will reduce and pretty much go away. So there is this idea that if you are allergic to a food, avoid it. Again, that is a short-term fix. If you really change your physiology somewhat, if you change your physiology, then you can continue to consume the foods that you're feeling like the need to avoid. On that note, there's one other thing that I'd like to add. Say you're doing muscle testing. You're muscle testing. Not everybody does muscle testing, but there are people who do muscle testing. Some people might do scanning, and they'll go, you're giving the body, you're changing the physiology something, and they'll muscle test and they go, the body doesn't like this. Or they'll scan and they'll go, this isn't good for the body. You have to be really careful with evaluating that way, because the issue is the body doesn't like change. And so when you're changing the physiology, almost every time if you muscle test, the body will say no. Who wants a big extra pile of work to do when it comes to some sort of task? Your body is not willing to say, I'm going to do all this extra work so long term you can be better. The body is just constantly trying to balance things. Sometimes, like say you're changing the physiology of the gut, or say you're treating cholesterol in the liver, and you're scanning and you're muscle testing, and at first it's going good, and then you reach this tipping point where your physiology starts to really begin to change. Then when you start to muscle test, the muscle test will say, oh, not good. Or you'll scan and go, no, not good for the body. Body doesn't like, not good for the body. It's because the physiology is changing. You're making the body be different, and the body does not like extra work. It doesn't judge this is good for it or this is bad for it. Like, oh, long-term, the cholesterol is going to be down. It's really good. Or long-term, I'm not going to have allergic responses. It's in the moment, right? It's just seeing extra work, and it doesn't want to have to adjust and adapt. It's not looking 2 weeks down the line, 2 months down the line, or a year down the line. It's looking in the here and now. And so methods of evaluation really need to be more strategic in nature, and not just like evaluating through muscle testing and scanning. And so, I'll leave that to you guys, but anytime that there's change in the body, let's just say the body's not thrilled about it, And so as long as there's no big symptoms or reactions or something like that, in cases like this where you're changing the physiology, I'd say push forward a little bit. Notice how you feel after like a few weeks, a few months. My rule of thumb with like allergy-induced asthma, most times within about 30 to 45 days, we can get them off their medication. That's not necessarily the goal. The medication just becomes irrelevant, right? We're just trying to reduce the symptoms. But even after the symptoms are gone, we don't go, we've reached our goal. I still treat that for about a year, sometimes even a year and a half, because I want to affect a physiological change that is set in that can last for a decade, maybe 2 decades. You're really looking long term. And so with this, almost everybody has agitated allergies in some area. It's not across the board, and it's not always hay fever or mucus in the nose or the respiratory tract or upset stomach from time to time. Not always like a little skin irritation. Sometimes there can be low-grade allergies that are impacting the body that affect functions and you're not really aware of. You could be not really showing any signs, but you could be having some of these emotional responses. And so with that, anger, stuck in grief or sadness for long periods of time where you don't feel like you can break out, I'd almost guarantee you it's tied to some immune function. And so with that, we want to try to tackle as much as we can. We're going to go through and do some treatments. You'll see some of this has been in some of the other classes, especially the part with the autonomic nervous system. We did add a piece that's not, I don't think has been in there before. But autonomic nervous system issues are not really super discussed in the West too much. They are actually in Europe, but not in the US. And so we're really trying to bring this to the table. The one issue that you see being discussed in the US these days is issues with the vagus nerve. And people are starting to explore that, which is good. But, there's more to the autonomic nervous system than the vagus nerve. Vagus nerve is a big component, but we want to look at more things than just, again, a symptom of one particular thing. So anyway, let's get started and let's just go through and treat agitated immune response. And so with that, we tried to put in as many choices as we could. Allergy support, I think, hasn't it been in one of the kits? Yeah, it's been in one of the kits. And so I think several of you probably have allergy support, but allergy support's good. Sweet Annie, mugwort, artemisia. Blue tansy is really good for allergies. Blue tansy actually has a component that helps your immune system and your emotions be a bit non-reactive, and it has an antihistamine effect. Armoise, I don't know how to say that. I think it's Armoise. It is a form of artemisia. And then Anua is Sweet Annie on steroids, basically. So let's have you pull out something in this realm. Artemisia didn't get listed, but it's also a type of mugwort. So you could use any of those.
For someone pregnant,
if you're pregnant, I probably wouldn't do this particular protocol right now. Like, if you wanted to do a little bit of it, I would do it with blue tansy. I really wouldn't use any of the other things. You could use allergy support as well, but I probably wouldn't do the mugworts and artemisias and things are a little too intense for somebody who's pregnant. So let's have you just maybe not do this particular protocol, or if you had some blue tansy, you could do a little bit of
it. If they don't have the oil, do you want me to start checking and see what oils they do have, or should they just sit out for the sessions?
Yeah, there's not going to be a lot of secondary choices.
No one said anything. it was just-
Okay. Yeah, if they don't have anything, let us know and we can see if we can find some, but there's not a lot of secondary choices. Okay, so notice how your body feels. Pay attention to your breath, your gut, your emotions, and your mind. Okay, begin inhaling. Your awareness is on the crown. Keep inhaling. Move your awareness to the right sole of your foot. Your left palm. Put your awareness on your right palm. The left sole of your foot. In your crown. Just be still. Keep your eyes closed. Just be still for a moment. Notice your body. Notice your joints, your gut. We're going to do the same application over again. So again, begin inhaling. Your awareness is on the crown. The right sole of your foot. Your left palm. Your right palm. Your awareness is on your right palm. The left sole of your foot. Awareness is on your crown. Keep inhaling, your awareness is on the crown. Just be still. Let everything go, just be still. Begin inhaling again. Your awareness is on the crown. Go to the left sole of your foot. Your right palm. Your awareness is on your right palm. Move over to your left palm. Your awareness is on your left palm. The right sole of your foot. The crown. Just be still. Keep your eyes closed, just let it incubate. Again, begin inhaling. Your awareness is on the crown. The left sole of your foot. Your awareness is on the left sole of your foot. Your right palm. Your awareness is on the left sole of your foot. Move it to the right palm. Move your awareness over to the left palm. You're on the right sole of your foot. Long, slow, deep breaths. Your crown. Your awareness is on the top of your head. Just be still, be aware. Keep your eyes closed. Just let it incubate. Just keep your eyes closed and let go. Same oil, new application, begin inhaling. Your awareness is on the crown. Move your awareness to your forehead, where the hairline is. Your ajna, the area between your eyebrows. Move your awareness to the throat. Move your awareness to the back head, opposite your eyebrows on the back side of your head. Go to your front heart. Your awareness is on the front heart. Move your awareness to the back heart. Move your awareness to the lungs. Your front solar plexus, below your ribs on the front side. Your awareness is on the back solar plexus, your mid back area. Your awareness is on the liver. On the right hand side below the ribs, do front and back side. Keep your awareness on the whole liver. Your navel. Over to the left hand side below your ribs, the front spleen. You can do your front and back at the same time. So on the front side below your ribs, and then the corresponding spot on the back. Your low back area, the Mingmen. The low back opposite the navel, but on your spine. to the sex chakra, where the sex organs are. The bottom of your tailbone, the basic chakra. Just be still, be aware, just let everything go. Just let it incubate. Notice your body, notice your emotions, your mind. We're going to cycle through that last piece again, but I'm going to give you a break before we do it because it was pretty intense. Here's the other thing, is when we go through and we do the components that we just did, these 3 applications, there is the potential for, you could say, emotions to come up, but it's not psychological emotions. It's you're changing the body. And so like little bouts of like things like anger or resentment or something that's actually locked in your body, locked in your physiology, tied to like physical experiences. You know, even if you're in a difficult situation, you have your emotional responses, your mental responses, but your body is also responding to these situations. And so you're changing your emotional responses and you're changing the ways that you get triggered. And so this isn't the whole package that we're doing today, but it's a good piece of it. We're actually going to do a series over the next few months of some free classes where we're just going to go down this rabbit hole kind of deep. And this is the first component. And it will impact your physical health, but it will also impact your psychological health because you're changing the way that you get triggered and respond to things in the environment. Okay, so before we take a break, let's maybe just have a few people, we won't do everybody, but just maybe a few people share their experiences, or you can unmute yourself or type in.
Good morning to all. I already typed in, but as it was happening, I became aware that while we were breathing and focusing, my left eye started twitching. And then after a while it stopped. And about the time we got to the liver, then I started having hiccups, which, you know, another reaction and a number of different little things that finally kind of mellowed out as you stopped. But when you said we're going to take a break, I thought, oh, good. Thank you.
Yeah, it's a little bit of an intense process. And the thing is like, you know, you could say hiccups are like tension or spasm in the diaphragm, but also you are changing your physiology a little bit. And so you are having a little bit of like a re-education process to the involuntary part of the nervous system or the autonomic nervous system. And so you'll get like little weird things pop up. They usually come up and then go away.
Yeah, they did.
The diaphragm is like the big like mothership for a lot of it. You know what I mean? And so that you got hiccups, yeah, I could see it. Yeah. even when you are releasing, say you're releasing a trauma, for example, there is levels or stages of the release, right? So one is the psychological impact, where you generally are thinking and feeling about it. And then a little bit deeper, you're starting to maybe get into like the ideas or the decisions that kind of came out of it. But as you keep going deeper and deeper, it keeps going deeper into your physiology. And when you start to have a really super deep release, the 2 places that it comes out of is the diaphragm and your spine. And so you'll have a deep release out of the diaphragm and the spine. That's usually that issue. You could say leaving. A better way of saying it is it's disentangling. Like, you know, you still have the experience, but you don't have the emotional response or the trigger or anything left. But this is directly tied to the activation of the heart. When the heart keeps getting more and more activated, it naturally allows for things to expel or leave. And so for the ones that are doing the vital center work and doing the work that we do on Wednesday nights, where we're doing the 99 aspects of the heart, the reason why I'm having to monitor everybody like after the fact is when you go through and you activate the heart like that, emotional, mental things come out, yes, but it starts cleaning up your physiology like nobody's business. And, people were having like old traumas and things come out, even though we had done all the prep work. And so when we committed to doing this class, it was like, I'm going to have to monitor and make sure that nobody, gets too overwhelmed by something. And so we had to do several healings on people just to stabilize them. It would have eventually passed, but I'm of the sorts of, there's no reason to be uncomfortable if we can make it better. You know what I mean? And so the places where it was coming out, which, like, in a way, a lot of healing modalities or healers, like, they won't really think of something psychological coming out of the spine or out of the diaphragm. It's because it's coming out of your physiology. It's like the physiological imprint of the event is coming out. So say you're in a situation where somebody's passing and you're kind of the primary caregiver, and everybody's kind of has issues coming up and they're acting out a little bit, and you're getting the blunt of it because you're the primary caregiver of the person who's making the transition. You're in a good place, your emotions in your mind are great, but that everybody's agitated with you and kind of coming at you, and you're having to play peacemaker. Emotionally, mentally, you might be fine about it, but your physiology, not too happy.
Yeah.
And they could be grinding on you and not even in front of you. Like, that's the
Mhm.
thing. It could be that they walk into the next room and they quietly have a conversation about you and just your physiology still picks up on that. And so things like resentment and anger and grief and sadness, the last place that they come out of is your physiology. And all of that really highly impacts the immune system, and it impacts the nervous system and the endocrine system. So here we're going through and we're really unwinding the immune system. So you might have like these little weird things that are coming out. For me, sometimes I have really like random thoughts come through my head, like, oh yeah, I remember that situation where it's almost like your life flashing before your eyes.
Yeah.
You'll have these incidences that you don't even think about them, but as you go through and do this process, I go, oh yeah, I remember that time, and this person did this and they did that, and you recall these like little weird situations, and you go, that was really actually annoying or hurt my feelings, but I also forgot about it. You know what I mean?
Yeah.
And those things are locked in the body. You could call it muscle memory, but it's more of that your immune system, nervous system, and endocrine system, all three have a memory. Not like how your brain has a memory and you recall certain events, but they remember the things that it were exposed to it, so that it can adjust and adapt to things in the environment for the future. And so as you go through and you do these things, you're kind of resetting the memory. You're resetting the mode of action. And so as that happens, you start letting go of these agitations, and it will trigger like little memory responses. Did you have any of that, Peggy?
I did. I had a number
Yeah.
of them. And I was going to ask, totally non sequitur, but when people don't have the oil, one time in the beginning when I started taking your classes, you said, oh, just use the white light. I'm wondering, and I may be completely wrong here, is the reason I'm asking, even with a pregnancy, because pregnancy is a diaphragmatic disease, kind of temporary, but is it inviting them to just breathe along? Is that appropriate?
Yeah, it might still be too strong, because you have to factor in, you might have to factor in that it's not so much for the parent or the mother, it's for the baby as well.
I got you.
And so sometimes it's too much for the baby.
Well, thank you for making that clear.
I always try to keep a pregnant mother as just like, let's just keep you as happy as possible.
Yeah, for
you know
sure.
what I mean? Just keep mom happy.
Yes. Thank you again for everything.
You're so welcome. Anybody else?
We had a lot of people with physical response things going on. But
go ahead,
Peggy.
Share your
Peggy Bonafil.
I had.
Hey, Miss Peggy.
How are you? I had beautiful animal visions.
Oh, nice.
Yeah, and I don't usually see, so when they popped up, it was like, hey, that's great.
Hey, you'll have to let me know how your little situation worked out.
Okay, I'll get back
Just,
to you.
yeah, at some point, yeah. So anybody else want to share?
Okay.
Hey, Greg.
Hey,
Hey, boy. So I don't have any emotions or anything coming up, but boy, what
no,
you said
it's,
about the physical. Whew.
I was kind of talking about you without mentioning your name.
Yeah, I'm like all of a sudden this wave of dizziness just hit me, and I was like,
Yeah,
oh, I might throw up.
right. So
Yeah.
for you, it was, you weren't having a, like from the emotional body or mental body, but your physical body was letting go of like the emotional triggers that it would use to manage the external environment. And so you were having a bit of a response because of what was happening for the last several months, or God, it's been longer than that, like year and a half.
Yeah, long
Yeah.
time.
So with that, your constant exposure to aggression from people around you, and whatever they are grinding on you, the normal response for the body is to produce resentment. So if you think of like when you're transmitting resentment, or when you're transmitting, like when you're doing forgiveness, for example, energetically, that is your Ming Men, which is your low back, your back heart, and your crown, right? So you are flushing this out of the system. The very first piece, the Ming Men, is actually unwinding it from the body. It's not even about your emotional body. It is the body has had a physiological response. And another way of saying transmutation is you're raising the vibration, right? You're raising the vibration of the body. So that means that the body has to have a reckoning with these emotional responses or these triggers. So it has to change the physiology of the immune system, the nervous system, and the endocrine system to be able to move that up to the heart, where now you can deal with it on an emotional level. Then emotionally you transmute it, and then it moves up to the crown. And so there in the crown, you're starting to deal with the thought processes that are the byproduct of everything that happened, right? So when we go through and we're doing this, you're really unwinding the body component. You're really unwinding the body component. Usually the heart goes relatively, I don't want to say easy, but easier, right? And then the mind, it can get stuck again, because the mental body has gone through and labeled it, stuck it on the shelf, created stories about it, and is somewhat entangled with it, right? And so sometimes what happens is the crown is reduced in size because of the inability to release it. But the material that you're transmuting is coming from this first component. It's coming from the unwinding of the body, which is tied to the Ming Men. So sometimes people will have Ming Men issues, like it'll fluctuate in size, right? It's not necessarily tied to the blood pressure, but sometimes what's happening is it's trying to raise the vibration of the body. It's a lot of times trying to raise the vibration of either the immune system, the nervous system, or the endocrine system, because of things that they've been exposed to and the things that it remembers that has gotten imprinted on these three systems. And so sometimes the fluctuation is actually coming from that. Then once it's unwound, that it goes up to the emotional heart, it gets transmuted, and then eventually it goes up to the brain, where it's getting transmuted mentally. But if the person has really gotten entangled with all those responses and created kind of stories with it, it'll get stuck there again, right? So we're going to work on some of these first components. Later, we're going to work on some of the later components and another free day of class. So we're really going to look at rebooting these responses to have like an impact on on those three systems. Those are the three systems that have memory, but then also to unwind the effects that they've had on the emotional mental body, because the effects they've had on the emotional mental body directly correspond to the impact they'll have on your spiritual connection or the connection to the higher soul. Basically, it's not just about experiencing the higher soul or having nice meditation. If you have a reduced connection to the higher soul, that means you have a reduced level or degree of life force. It means your body doesn't function as well, the processes don't function as well, you don't have the fuel or gasoline for your body to heal at a faster rate, right? So we're not looking at simply from the point of view of like, oh, I'm trying to deepen my connection. You're trying to deepen the connection to create a form of longevity in the body that is not needing lots of maintenance. You know, the more spiritual energy that comes in, the more your body heals of conditions at a much more rapid rate.
Thank you. Thank you.
Yeah. So you feel better, by the way?
A little. I still feel a
Yeah.
little dizzy, but
You got the message that we sent you?
I did. I did.
Okay, good.
I hadn't
Just
had-
do that on the break. Just do that on the break. It should pass.
Oh, do the emotional part? What you said?
Yeah, do the emotional part we sent you.
Thank you. Thank you.
Anybody else want to share before we take a little break?
Someone said, started having strong pain in the pad of left foot. Weird. The left side energy releases from random places. Is this just the anger releasing?
Not sure. I mean, it could be left. I'm not sure. Let me see if I can see what it is, but right now I'm not sure.
My hands are numb, and then they did a follow-up. I can't move my hands at all, and then the feeling just started coming back and tingling and can kind of move their hands.
Just with doing the process, or they were like that before?
Just doing the process.
Yeah, boy, that means there was a lot of agitation in the immune system. Yeah, get up and just try moving around a bit. You know, we'll see. We'll check in with everybody when we come back. I was going to do another cycle of the last application, but it might be a little too much for everybody.
Broke out into a sweat. Then
Yeah.
the lungs had a deep release of accumulated
Yeah.
grief, sore throat, and headache, but much better.
Yeah,
Felt like I had a glass of wine and a massage. Tears in step 3. Body
Yeah.
feels cold.
yeah. Your body's your body's going through an adjustment phase, so it's gonna be weird. It should pass pretty quickly, but if there was a lot of agitation in the body, you know, it's I say agitation, we're usually not conscious of it until it starts to shift. And think of it like this part of your immune system has had its guard up and has like been, you know, I'm taking all comers, right? And now you're trying to tell the body, hey, you can put your arms down, you don't have to take on all comers, you don't have to put your hands up and be fighting everything that comes your way. And sometimes your body doesn't believe that for a little bit. You know what I mean? And so you're doing something that is breaking a habit or a pattern of the body. And so this is why allergies can be so hard to treat, is we get so used to being in that state that we really don't realize that, hey, I could be in a more calm and relaxed state. And so it takes a little while for the immune system to get re-educated. You know, this is actually, believe it or not, still kind of a small step. It's not shotgunning everything. It's like a piece. You know, we're doing a piece and you're letting your body get acclimated. And you know, a little bit later we'll do something deeper. But if you can change the immune system, you really can change thought processes and emotional states. Let's say it like this: your ability to be happy and get along with the people around you directly corresponds to your immunity, your nervous system, and endocrine system.
Narayani?
Yeah, hi. So I was trying to find the button for raising my technical hand, but I couldn't find it. So I'm raising my. I didn't want to interrupt. Hi, Greg. How are you? Nice to see you.
Hey, how are you?
I'm good, thank you. Yeah, no, I wanted to share, and I have a question tied into it. I felt this kind of, I felt very connected and very grounded doing the practice, but these waves of intense heat through my body, especially through my chest and my heart. And I've been having this a lot recently. I've been dealing with chronic Lyme disease the last couple of years, and I only really sort of discovered it actually knew it for a fact the last 6 months. And it makes sense now to understand all the symptoms and what my system has been going through. But even though I've been doing a lot of things to strengthen my immune system, what I feel now, I've become more sensitive, if that's the right word, to everything around me, you know, environmental factors, even oil, some of them, like I'm just responding and reacting to everything. So although I'm doing a lot of things to strengthen my immune system, I feel like I've become hypersensitive to foods.
Well, that's the thing, is sometimes when you have a hypersensitivity and you strengthen the immune system, sometimes what you're doing is you're strengthening the hypersensitivity.
Yeah.
So there's times to strengthen the immune system, and then there's times to re-educate the immune system. And it doesn't mean that strengthening the immune system is doing something wrong, but like if it has something that it's doing that's not good for you, and you keep strengthening it, because I mean, that's what we kind of do in the West, is we try to just strengthen everything. But what happens is like say autoimmune issues is a perfect example. If you strengthen the immune response with an autoimmune issue, it just increases the immune system's ability to go after the body. So like the thing with allergies, which, you know, there's different kinds of sensitivities. Allergies is just one of them. So for one, it's an inflammatory response, right? It is basically inflammation. So what we're also talking about is the aging process. Your aging process is tied to the component of the allergies or the allergic responses and your inflammatory responses. But strengthening is one component, but what we're talking about here is actually re-education. And when you re-educate, you're changing how the immune system functions, and you're pushing it back more towards the way it's supposed to respond. And so a lot of times what happens with hypersensitivities and things is, you know, you have an exposure, 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 and pretty soon the immune system, because of all those exposures, is functioning very differently than the way that we were wired, because the immune system has a memory, and those exposures have kind of taken it off track from what it normally does, and it's like kind of engaging in a fight with something, and when that something goes away, it just says, yeah, this is the new us, like this is what we're doing. That might come back, and the memory in the immune system doesn't necessarily go, okay, it's done, let's go back. It just goes, no, this is what we do. And so when you go through and you re-educate the immune response, all the strengthening you've done makes your immune system stronger, but it's directing it to something different, if that makes sense. And so both are necessary. And so the thing that gets overlooked in the West a lot is the re-education process. You know, we just kind of take into account that we are where we are, and we're just, you know, trying to manage what's happening. But in the West, a holistic approach a lot of times is using a natural substance to do something that could be done with, medications or something from the pharmacy. And really what we're saying is you're wanting to have a holistic approach. That means you're wanting to keep bringing the body back to a place to where it can heal itself and where it can manage these issues and not be super hyper sensitive or hyper responsive. And so anytime the immune system has gone into a sensitivity, the need for re-education is at the top of the list. And that would include autoimmune issues. I would say at some point, after the age of probably 21 or 25, a person needs to have re-education of the immune system. If the person was very sickly when they were young or had a lot of allergies when they were young, then even earlier. But usually by the age of 21, you're needing to go through and unwind this. Now, the first component that we did before we did that last third application, the third application is really what is having a re-education component on the immune system. Those first two applications were the transmutation of the will. And again, it's not the emotional will that we're looking at. It's not the mental will. It's not the spiritual will. We're looking at the physical will, because part of these memory mechanisms are very tied into your physical will and your ability to thrive in the environment. And so when we go through and do this, if you're having a really hard time with that last component, do the first two applications first, because part of the issue, part of the approach of like the hypersensitivities and the autoimmune issues or the food sensitivities is it's starting to be the lower will, the will to survive, tied to the basic chakra, is starting to be misdirected and go at things that are either unnecessary or actually even supportive of nature. It's in a fight and it's just looking for a fight. It's like that old saying, when you're a hammer, everything's a nail. When you're a basic chakra, everything's a fight. And so the issue is that we want to keep transmuting that as much as possible. And then when you do the third application, you're going through and you're flushing out the immune response itself. You're basically re-educating the memory. And so you can do it in little baby steps. Don't make yourself super uncomfortable about it. It's not about going through a detox or something like that. Do it in little tiny steps. If it's too much intensity with like what we just did, like back it down and do half of it. Do it like half intensity. Still follow the steps, but if you're finding even the third application is a little much, then do the first two applications.
Yeah,
does that make sense, Nora?
Totally. Everything you're saying, it totally resonates, because that's what I feel like my body's been in this fight this last few years. I'm almost unsure of what re-education in my system looks like, because that brought me to part of the question was I grew up very sickly and always on medication, antibiotics. That's all that was known to do back then.
Right.
Sick, okay, put you
on.
It's
what we all did when we were young. I mean, unless you had like a mom who was in super holistic stuff, you took things over the counter, you took things from the doctor, or you just suffered through it. And
well, that was it. I think I became very sort of unable for like my immune system to kind of fight anything off itself, because I was constantly, reinforcing being sick. And it was only when I got to sort of be my late teens, early 20s, they removed my tonsils, saying that might be the answer, which of course I don't have anymore. But
they in the old days, they used to do that just no matter what. Like you're old enough, you should probably have your tonsils out.
Yeah. And now I feel like I've spent the last 20 years of my life trying to build a healthy immune system and living a healthy way and doing things that support it. But I feel like I'm always
still do the strengthening things, but then balance it with some re-education part. And like you said, re-education isn't really taught. Even in holistic practices, a lot of times it's not really taught. I think Chinese medicine addresses it somewhat, but you know, there are practitioners who do it, but it's not common, it's not popular, and a lot of times I would say it's not understood. You know, like re-education is understood as far as the nervous system is concerned, especially by osteopathic practitioners. But in the old school osteopathic approaches, they would look at re-education of the immune system and of the endocrine system. But I would say that people really have to have, I don't know what it is. Like a lot of times we're not motivated until we have a problem, you know what I mean? And so re-education of the immune system doesn't come up until we have a problem. And then when we're in the middle of a problem, a lot of times we just go, I just want everything to be stable. I don't want to really have to rock or change anything. When here we're saying we're going to change some things, and there might be a little bit of temporary, you know, emotional things that come up, or a little bit where the body, you know, like some people had a little bit of sweating or a little bit of aches or pains come up. It's your immune system is shifting and adjusting, and so the sweating is tied to actually the autonomic nervous system, like it's starting to re-educate the autonomic nervous system. And you're changing the immune system so much that it's actually throwing the autonomic nervous system is starting to say, hey, there's change. We don't know what's going on. You're breaking out of your normal parameters of action, like, you know, you're changing it, and so the body's having to adjust and adapt. So that's why we are doing this in baby steps, because we don't want to throw the body in crisis. It usually would only be for a few minutes or 15-20 minutes, but even that I don't like to do. Like I like to do it just like little baby steps at a time, and do it over a period of time so that just the body can keep acclimating. And so if you do this over a period of time, you'll notice that your immune system is better and stronger. You're not as sickly, but also inflammation will go down, because the byproduct of the immune system being so agitated is heat in the body, and lots of inflammation in the body. Like the body will have inflammation for kind of no rhyme or reason. You know, it's basically the aging process is getting accelerated. Aging process equals inflammatory process. You know, your body breaks down when there's excessive amounts of inflammation. And so when the body is aging and breaking down so much, it is an inflammatory process. And so if you can calm and slow down the inflammatory process, which is the immune response, which is even deeper, the allergic response, then you actually change the aging process. You slow the aging process down.
Yeah, no, that all makes a lot of sense and is very helpful. I had just been totally backing off of doing a lot of the oil protocols for quite some time, because even doing a lot for a while, and a lot of other things which were helping shift symptoms on one level, but felt that they were making me more hypersensitive on another level. So it's like I'm trying to find a balance of enough, but not too much. And sort of I feel like I'm constantly bouncing back and forth between sort of, I don't seem to have like a normal point that I'm sort of like, I've gone all one way and I'm having extreme symptoms, or I sort of try and help support it and work with all these different holistic things, and then I get better, but I get in other ways. So it's like I'm sort of swaying back and forth between these two states. So yeah, I'll start again with this protocol slowly, because
slowly, especially the first two pieces. And again, the issue is like we can't have a cookie cutter approach. I mean, you said it perfectly. Is like you know, your body has these responses, and it's more of like an unwinding. Like you kind of do something and then you go, okay, adjust and adapt. You know, what's happening here? Evaluate and then like adjust. And so we want to keep moving forward with this. But if your allergic response was like perfectly where it should be, you'd go through this process and you'd go, yeah, it was relaxing, but you know, nothing really happened. When you start to have these responses, it's because it's shifting the allergic response or that part of the immune system. So like any time that we do this, like the emphasis is more on those first two pieces. And then you kind of go through that last piece, and then based on how you respond, you know, you can either do more or go, boy, I need to do a little bit lighter, and just maybe do it consistently for a while. One of the ways you can augment this is you can also do baths with the oils that you were using for this. The only one I probably wouldn't do a bath with is the allergic response itself, just because it has peppermint in it, and it would just be a little bit tingly in the bath. But all the other oils, you know, you could rub the allergic response on the body, like in a liniment or a lotion or something like that. But for the most part, there's that. And then we'll talk about supplements a little bit later today that you can use to treat the allergic responses.
Excellent. Thanks, Greg.
You're so welcome.
So we have a couple people with I feel more integrated, another with I'm relaxed. They said all because of the classes I've taken with you, the system feels it's clean. Is that accurate?
Yeah, you know, we've danced around this quite a bit. Like we have gone through and we've done things on the immune system, we've done things on the endocrine system, the nervous system. And so we're going through and we're unwinding this through various classes in different ways. You know, I was thinking about teaching this class about a year and a half ago. And I was like, oh, you know, I was going back and forth, back and forth, back and forth. And then I was like, let's keep doing some more of the other things, because, you know, it's in a way, it's a very simple class, but it's very potent, and sometimes the more that you clean other things up, it makes it easier just to make the transition as you're going through all these pieces. You're constantly unwinding things in the body. The transition makes it easy. But if you've had like a lot of exposures to the immune system, or a lot of difficult situations where there's been a lot of emotional responses, or, you know, you've had a really bad infection or something like that, all of this can agitate the body at any given time. And so has nothing to do with your higher emotional states or your higher mental faculties or your spiritual connection. This is really kind of going down to the cellar and treating some of the things in the body. And, you know, shifting that changes those upper factors. But the upper factors a lot of times had nothing to do with putting us in this place down in the cellar. It's usually been the wear and tear of life, you know, the exposures. And so, you know, we're a byproduct of our past, whether we're aware of it or not. Good and bad, you know. And so the thing is if we can unwind and re-educate these things, then we can be a little bit of a different person. And so when I was young, boy, I had really super bad asthma, you know, as a teenager. And, you know, I treated it like Rainey said, like, you know, you do the medications, you do the inhalers, and I was just like, it just kept getting worse and worse. And I would stimulate the immune response, and it would actually make it worse. And then I just went through and I did some of the things that we're talking about here. And within 30 days, it was like 30 or 32 days, I think, all of a sudden I realized I haven't taken my inhaler for like a week. And then I was like, well, I'll probably need it. And like 6 months went by, then a year went by. And then I realized, don't need my inhaler anymore. And so I literally just got up and threw them in the garbage. Still treated it for, I think for me, I treated it for about 3 years. And night and day difference, and I've never really had to go back to do that level or degree of treatment. Every once in a while I do a little tune-up just because I don't want it to come back, but yeah, it's nothing like it ever was. Sometimes when I get sick or something, I'll have a little bit of symptom, but it was just done. It just, once the allergic response got re-educated, it changed. And doesn't mean that it doesn't need more maintenance, and it doesn't mean that it doesn't like show up in different parts of the body, but that component was pretty much done.
And some people's response was, I just got super relaxed, dropped the bottle, I fell
Yeah,
asleep, some
yeah.
visions and memories of feelings and thoughts of aggression,
Yeah.
not acting on the past.
The deeper impact will be, you'll start having emotional things come up, like, or not even emotional. You'll have flashes of things from your past, things where people were aggressive to you, or where there was some sort of conflict or opposition, or your feelings got hurt, or something that you were maybe angry about in the moment, but then you forgot about. And as these things kind of come out, you'll have these like little flashes, and sometimes they're almost like kind of funny because you're so far away from it now, but in the moment it didn't feel funny.
And then could this protocol help with, it's a dermatomyositis. It's an autoimmune disease that attacks the skin and muscles. Right now it's inactive, but with a lot of stress, it could be reactivated.
It could possibly help, but I would go back to the autoimmune components that we did in the study groups.
Yeah, and just email me for that information.
Yeah, we have them all up on YouTube, but we can give you a direct. Anything autoimmune, you want to treat autoimmune. I mean, this could help, but still you want to treat the autoimmune issue directly. Okay, so how about this? Let's take a break. It's 11:05. Let's come back at 11:20, and we'll visit if we're going to do this again or move on to something else. Okay, so I'll see you in 15 minutes. Hey everybody, let's come on back. So let's do this. This is part therapy, but we also want to do a bit more education. But I want to go through and talk about different particular symptoms that can come up and how to eradicate them. But let's just build on what's happening, and let's go through and do a little bit of re-education on the autonomic nervous system. So if you drop down to page 11, which is G, the autonomic nervous system. So flip forward to page 11, G, autonomic nervous system. So anytime you use the term regeneration, a lot of times what you're talking about is re-education of either the immune system, the nervous system, or the endocrine system. So here we're going to go through and do re-education and regeneration. Okay, now there's two oils that work exceptionally well in this arena, and that's spikenard and valerian. Spikenard and valerian are incredibly good for the nervous system, and they're also incredibly good for muscle imbalances, skeletal muscle imbalances, but sometimes the imbalance is also in smooth muscle. Smooth muscle, which is what your digestive tract is made up of what your respiratory tract is made up of, and your urinary tract. And so when we're looking at this, we want to basically re-educate how the nerve flows to this particular area. We're going to come back after we do this and go back to where we left off, and then talk about symptoms and kind of work our way through this immune response or the allergic response. But right now, just to build on what we've done, and you guys have some things come up, I want you to see the potency of what this is. Now, spikenard and valerian, some of you probably have spikenard. I don't know, some of you might have valerian as well. Either one works. They work equally as well. If you don't have it, for the sake of this protocol, I mean, lavender kind of works, but the go-to thing is spikenard or valerian. So if you're having this issue, spikenard is really super good for this. Spikenard is really super good for the digestive tract. It's calming and soothing to the digestive tract. It's very good for imbalances in the digestive system. It's good for when there's been long-term bacterial infections in the gut. If there's any other sort of ongoing digestive issue, it's more about balancing out the gut than it is about treating a particular symptom. But if you have like a nervous stomach, or there's been a lot of inflammation for a period of time, valerian or spikenard taken internally is incredibly good for the gut. So with that, we're going to be doing inhalations.
If they don't have spikenard or valerian that have spikenard extra, what's better, spikenard extra or lavender, or is that even?
Yeah, spikenard extra is actually made for something else. I don't know that it would actually work for this.
They may have lavender.
Yeah, like I'd say try lavender or vetiver. Nowhere near as good, but it's still better than nothing.
If they have maybe it's the ointment, maybe if they have spikenard magnesium.
Yeah, that's the ointment. I mean, you can open the bottle and inhale the ointment if you want. I mean, we're doing an inhalation process, so.
And that's pretty much it, right?
Yeah, like if you don't have any of those, let us know and I'll try to come up with something, but. Okay, so begin inhaling. Your awareness is on the front heart. Move your awareness to the back heart, the area between your shoulder blades. Chamomile might work.
They just gave me a bunch of kits that they have, so I'm going to.
Back to your front heart. Your back heart. Your awareness is on your front heart. Your awareness is on the back heart. Go to the jaws, jaw minor, where the jaw hinges in front of the ear. your back head. Your awareness is on your back head. Just be still for a moment. Keep your eyes closed. Just be still. Again, begin inhaling. We're going to do the same application. Your awareness is on the front heart. Your awareness is on the back heart, between the shoulder blades. Your awareness is on your front heart, the center of your chest. Your back heart, between your shoulder blades. Awareness is on the front heart. Your awareness is on the back heart between the shoulder blades. Go to your jaws where the hinge in front of the ears. And the back head. Just be still, be aware, keep your eyes closed. Begin inhaling again with your awareness between the eyebrows. Move your awareness down to your throat, the center of your throat. Down to the throat minor, the bottom of the throat. Go to the cheek minors, right under the cheekbones. The jaw minors, where the jaw hinges in front of the ear. The ear canals themselves, the holes in your ears. The back heart, the area between the shoulder blades. In your front solar plexus, below the ribs. Your back solar plexus, your mid back area. Just be still, be aware, keep your eyes closed. Just be still. Let everything go. And let's do that one again. Begin inhaling. Your awareness is between the eyebrows. Down to your throat. Your throat minor, a little notch between your two collarbones. Your cheek minors underneath the cheekbones. Jaw minors, where the jaw hinges in front of the ear. The ear canals themselves, the ear minors. The back heart. Your front solar plexus, below your ribs. Your back solar plexus, your mid back. Just let go. Let go of everything. Just be still. Just let it incubate. Okay, begin inhaling again. Your awareness is on the front solar plexus, under your ribs, on the front side. Your back solar plexus, your mid back area. Awareness is on your back solar plexus, your mid back area. Move your awareness over to the spleen, left hand side below the ribs. Your navel. Inch and a half below your navel. The bottom of your tailbone, the basic chakra. Your awareness is on the bottom of the tailbone, the basic chakra. Go to the front of your knees, below the kneecaps, the front of your knees. The back of your knees. The soles of your feet. Just be still, be aware, just let everything go. Begin inhaling again. Your awareness is on your throat. Drop down to the bottom of your throat, the little notch between the collarbones. The back throat, the middle of the back of your neck. The jaw minors, where the jaw hinges in front of the ears. Your temples. The back head, opposite the eyebrows on the back side, the back head. the forehead, where the hairline is. Your awareness is on the forehead. Your brain. The cervical area, the bones in your neck. Your upper back, your upper spine between the shoulder blades. Your mid back area, the bones in your back, your mid back. Your lower spine, the bones of your lower back. Go to the floor of your pelvis, the perineum or perineum, the area between the anus and the sex organs, and the floor of your pelvis. The soles of your feet. Just be still, be aware, keep your eyes closed, just let go. Okay, how do you feel? Especially if you had some symptoms coming up from the last protocol that we did before the break. How are those symptoms now? And just for everybody, how are you feeling? You can unmute or type in.
Hi, Greg. This is Fabi.
Hey, Bobby.
How are you?
Good, good. How are you?
Good, good. So, the first two protocols,
You cut out. I can't hear you now.
keep trying. Then,
There we go. I didn't hear what you said. You cut out there for a bit.
oh, can you hear me now?
Yeah, yeah. So after the first protocols, what happened?
I had a lot of congestion, and
Okay.
then I start like crying, but not emotionally crying, just physically, which is weird.
Sure. Yeah, yeah.
And now everything is gone. My body
Yeah.
is much calmer. I'm not congested anymore. Like my throat cleared out. It was like a 180 the difference.
Oh, good, good. Like sometimes that's what happens is like as you go through and re-educate the immune system, the nervous system and the immune system, especially the autonomic nervous system, they work so closely together that sometimes you got to balance it out.
Okay, good. Well, thank you.
Yeah,
Just want
yeah.
to let you know
Good.
that you worked it out.
Good. I'm glad you feel better.
Yes, thank you.
Anybody else?
Becky Bonfold?
Hey, Peggy.
Hi there. Okay, so I got so relaxed I kept dropping my oil and losing my place. It's like, where am I? Job. Okay.
That's
a little
okay.
bit. I know a little bit of numbness in my cheekbones. I think from the oil, but maybe from what we were doing, and it's gone now.
Okay, good. It's probably from the oil.
But I feel great.
Good, good, good.
Yeah.
Go ahead, Carol.
Hey, Carol.
Hi, Greg.
Hey, how are you?
Hey, Greg, my hands were paralyzed from the first round. I couldn't move them. They were paralyzed. I dropped the oil and I couldn't move. And then they were numb for quite some time. And then I listened to your explanation and I did this round. And my body is twitching, but I'm not relaxed. So I'm wondering, am I fighting this, do you think?
I mean, if that is the case, it's your body, it's not your emotions or your mind. And so, like when you say your body's fighting it, like give me an idea, like what's happening?
My shoulder is up, like my shoulder goes
Your
up.
shoulders are up. Yeah.
There's parts of me are twitching. Just, I'm not feeling comfortable in myself. In the past, I think around now I would have a meltdown, but you helped me a lot with that.
Yeah, like sometimes, like how we talk about like fight flight's not necessarily always the best explanation. It's just like kind of a term that gets thrown around, but a lot of times it could be fight, flight, or freeze. And I think that like as the guard goes down, your body feels like kind of vulnerable, and it's almost like engaging the fight, flight, or freeze mechanism a little bit. And so I'll look at it. We're going to go on break here real quick. I'll look at it and we'll get you stabilized here real quick. Based on what we kind of had talked about before, I did want to kind of watch over you as you went through this today. And so, yeah, we'll address it.
Thanks, Greg.
You're so welcome.
And Barbara?
Hey, Barbara.
Hey there.
Hey.
This round was quite a trip. As soon as we started, I felt a lot of congestion in my head, particularly a band around my eyebrows and my back head. And the second time we did the first step, I started feeling a little spacey. But then I started feeling like I was transmuting something.
Yeah, that's exactly what was happening.
Possibly a relationship, possibly something bigger. We got to the third step. Second step. I felt like my chest cavity and my abdomen were like hollow. Like I wasn't aware of, like the organs suddenly disappeared and I started getting cold.
Okay.
I kept getting colder and colder. At one point I felt like there was all this sadness, but it wasn't mine. I got just progressively colder, and at the end the head congestion came back. I actually took my temperature at the
Physical congestion or energy congestion?
energy congestion.
Okay,
Physically
yeah.
feels very clear, energy congestion. I actually took my temperature. It's 96.7.
Hmm. Maybe take it again in like about an hour.
Okay.
Yeah. Yeah. We are re-educating the immune system and now the autonomic nervous system. And so we're not just calming it down, we're actually re-educating it. And so sometimes it takes a little bit for things to like recalibrate. And
Okay.
so it depends on the difficulties that that particular body is having. So there's no like cookie cutter way of saying this is going to happen, that's going to happen. It's just these weird random things come up, and you just try to do it a little bit and then just let it acclimate, and then eventually you go back through and do it deeper. But I was going to do each one of the applications twice, but we're doing something kind of intense. So as we went through and we did a couple applications, the third and fourth I only did it one time.
Right.
It's because of the intensity.
Okay.
And so I could tell everybody was like, yeah, this is like kind of enough. Like this is good for what we're doing, and we don't have to go 90 miles an hour and cover all kinds of ground. We can just do a little bit and then let it acclimate. And so let's just make sure. Sometimes you notice with the immune system, people said more hot. A lot of times with the nervous system, it tends to be like more on the cool side.
Yeah, really cool.
Yeah. You're kind of like what's happening is you're going into a bit of rest and repair, and the allocation of energy in the nervous system is being shifted and rerouted, so to speak. And so you kind of are shifting out of fight flight. A lot of times, we throw around fight flight or fight flight freeze. We don't realize to what degree we're in fight flight because it's just our normal state, and it's not that we're like in crisis mode, but we all, because of past experiences, have our guard up to a certain degree. And so when we start to re-educate some of this stuff, it really, your guard comes down a little bit because it's the body putting the guard up, and you might feel more vulnerable, or it might feel a little bit and a little bit of time the body assimilates it and acclimates to it. But there's a few moments where it's like I'm not sure what's happening, because you're shifting the momentum of the body. And so remember what I said in the beginning, your body doesn't always, like if you were to ask your body, do you want to do this? Your body would go, no, we're not doing that. Because it's shifting the state that the body is in. And the body doesn't see it like, oh, that's a better state. The body just says, it's a different state. I don't want to do it. If you think about like, how many times have we been in a situation where we go, there's other possibilities or potentials that come in, and you just go, no, don't know why, just no. And it might be something that's really kind of appealing, but at the same time, it's your body is in a place of comfort, and it doesn't want to do something that's going to push it out of that comfort zone. And so here we're talking about re-educating the body, but even externally, sometimes we push things away because the body is very attached to that comfort zone. And if you're going to step out of the comfort zone, the body will go, no. Emotionally, mentally, you'll start to have cognitive processes that go along with it, but the first response is actually from the body.
Thanks. So just write it out.
Yeah, it shouldn't last for very long. Like
Okay.
like 10-15 minutes is usually it. Like I've had bouts with myself where it's been like an hour or two, but it keeps diminishing as time goes by.
Okay. Thank you.
You're so welcome.
And Tracy, your hands raised.
Hey, Tracy.
Hello.
Hey.
So I did the anger and resentment protocol while we were on break. And then I went through this one, and Well, it feels like the dizziness and nausea is sort of leaving, sort of.
Mhm.
And then, but there's a lot of nervous energy in my solar plexus, diaphragm area. It feels better though, and yeah, just
It should pass. Even that is still some lower emotions that are just being kind of released isn't the right way. Things are just being reallocated.
yeah. Every now and then I'll have a little tear, but it's like,
Yeah,
I'm not exactly sure what it is, but
it's
okay.
things locked in the body. You know, we have traumas locked in the body. We have old experiences locked in the body. We have old memories locked in the body. And as you go through and you do this, the immune system, nervous system, endocrine system all have memories that are tied to our memory mechanisms in our brain. And so as you kind of re-educate them, you have these little flashes that pop up. And then you realize that person hurt my feelings. I was upset at this person. This person was really super rude. And, you know, it's just these little flashes. It's nothing you're usually grinding on. It's just things that got locked into the body that were affecting these systems. Let's say it a different way. What I could have called this class today is cleaning the toilet really, really, really well.
Thank you.
You know, because that's what we're doing. We're going in and we're hitting like really root primal responses. And, you know, we didn't jump into this right off the bat, you know, a year or two ago. We've been kind of circling the drain, going through other things. But when you get into this root stuff comes up. But if we've gone through and cleaned up some of the other things, well, it doesn't really get attached to anything. You know, it kind of comes up and it passes.
I thank you. My husband thanks you.
Yeah. It will, like what we do today will reduce emotional triggers.
Well, that's really good when you're getting ready to go on vacation.
Yeah, it's really good for any time. You know what I mean? Any sort of business relationship, even meditation can trigger things. I mean, you think you're being peaceful, but you know, things come up.
Thank you.
Mm-hmm. Good.
Naraini?
Hey, Naraini.
Oh, yeah. Hi. Yeah, I was going to share, just to update, I decided to just take one breath in at each of the location. Only go through one round of each section and just sort of sit quietly and breathe and meditate in between. And it felt much gentler on my system. But I also, just like, I think it was Barbara who mentioned, I went very cold rather than the heat response.
Yeah.
Actually went sort of cooled down, so, which was actually kind of quite nice. And
yeah.
So yeah, that felt good doing it, just really backing off, just, you know, just a breath in each sort of thing, and then not
good.
too.
And so the physiology feels like it's calmed down a bit.
Yeah, from that earlier. I kind of went a bit gung-ho earlier, and I thought, yeah, let's, you know, breathing as deep as I could, and I kind of think I just sort of again triggered that response that comes up.
Yeah, like I would say, you know, I know I kind of keep saying this, but it's not about doing it all at once. I mean, I'm one to put the pedal to the metal, so I'm not one to talk. But the thing is, just keep gently nudging the body in this direction. It's not like an all or nothing. It can just be little baby steps over a period of time.
Yeah.
You know, so that's why we even kind of tempered and calmed down the applications. You know, I was going to do a little bit stronger, but you know, you can almost kind of tell, like, yeah, we're hitting our threshold. You know, and as a group, we were hitting our threshold. So, yeah.
Yeah, that was good. Thanks.
You're so welcome.
Donita?
Hey, Donita.
Hi, Greg.
Hey,
Wow, this was intense.
Mm-hmm.
Very, very grateful.
Yeah.
I have been, as you know, have been dealing with a lot of head tension and all that. The first protocol we did, there was, again, congestion, headache, dizziness, you know, a bit of nausea, all that funny stuff and jaw, you know, the tightness in the face.
Yeah, sure.
As we started this, I don't even know, because I kept dropping the bottle. there was so, my brain was on fire in a way, like this head space, the brain feeling really uncomfortable and had that.
Like thoughts or like
No,
feeling
no,
like inflammation or?
physically it felt like it was on fire in a way, like it was that raw itchiness, kind of tingly, painful, kind of just really tense.
Mhm.
The space between my temples, the jaw, basically my whole head, but especially the top part and the brain, it felt
Mhm.
really uncomfortable. But I stayed with it and I kept, going through as I normally do. And it started shifting and just went really into kind of like a trance.
Yeah.
Like body felt very, I didn't feel the temperature, no cold, no hot. It was very still. And I started seeing visions. Like, yeah, I kept going in and out of consciousness a bit. But I had some amazing visuals in a way, like I dove into my body, into my cellular system and cellular memory. It was just very, very profound, yet have no. I'm feeling the tingling, I'm feeling the head. Something is shifting. I can breathe easier, like the tightness is not as right now, like it's expanded.
Mhm.
So I'm not, but I'm loving it. Not
Good.
sure what's happening, but I'm loving it.
Yeah. Think about like this, like, as you were saying that, like I had just the visual of, think about when I said what we're dealing with, like primal responses in your body, both for your physiology and for your emotions. So it's almost like taming a bunking bronco or a horse, like it's, or a new puppy or something. You got something that's just kind of, as you delve into it, it's a little bit out of control and you just got to bring order to the chaos, right? And so you're re-educating something that has been on its own or running amok for a little while. And when you pull it in, it's not coming willingly. You're actually shifting the primal will, or the will to survive, and trying to redirect it so that it becomes more in alignment with the higher faculties and the strategy of longevity in the body. The body puts strategies in place, but longevity is not one of them. It's usually in just the here and now. And then it's like, think about like on your computer, you start doing something, you go down this weird rabbit hole, and then 2 years later, you're having to make all these adjustments because of that rabbit hole you went through. And at some point you gotta go, I gotta start from scratch and do this right. Where you kept putting a Band-Aid on it, a Band-Aid on it, a Band-Aid on it. And, you're using an old system and an old operating system and software that's maybe outdated or not doing everything that you need. And your body does the same thing. It starts to go down these weird rabbit holes and it just doesn't step back and go, let's reboot and do this properly, And so with that, when you get in and deal with the more primal aspects of what we're talking about, it's really another way of saying the animalistic side of the body. It's not the emotions or the mind. It's eventually it affects the emotions and the mind, but you're dealing with kind of the animalistic side of the body. And so it's really hard to predict where it goes, like the hot and cold, that's pretty consistent, but some of the other symptoms, it depends on what we've been through in our life. It's not always straightforward. And so, at any point, if the symptoms start to get a little too much, or like you said, you might cry a little bit and you're not even sure why, or you get a little bit upset and you're not sure why. And it's just the body is recalibrating and letting go of some just old agitation.
Thank you, Greg.
Yeah, you're so welcome. In a way, you would think that like the idea of treating allergies would be good for like the general public, but for me, I like to do something like this with experienced students because it is it's a little bit more hardcore than it seems. You know, it's one thing to just say, oh, this is good for this symptom, but you know, there's so much of things out there already for that are temporary fixes. Let's talk about how to go at this deeper. There's not a lot about how to treat this on a deeper level.
May I ask a quick question, please?
Mm-hmm.
Will this, because the part of my head recently, I noticed that I'm kind of, you know, the thought patterns, the thought kind of like it's like you said just earlier, and I feel like I'm entangled in my head a little bit, and I just tend to go into my head. I guess that's escapism of some sort, even though I feel grounded, but it's just lately I've noticed that I'm like in my head. So will this help with disentangling my head?
Potentially, you know, potentially. The thing that it helps with the most is getting triggered. You know, and sometimes what happens is we get triggered and then the instinctive mind comes in and then the stories start getting kind of produced and you go to those things in your head. And so the difficulty is that it's a very strong response from the body. And, you know, it's a very strong impulse from the body. And because the emotions are strong and the thought processes are strong, but they're still, instinctive mind means like you're having automatic thoughts. And so, you know, we try to rationalize them or to calm them down. Sometimes the story is trying to calm down these responses, you know, to give it a reason. And so if you calm those down, the drive for the stories diminishes and the drive of being in your head, paying attention to those stories diminishes. Does that make sense?
Yes, yes.
Yeah.
But is there anything that you would recommend to kind of, besides the hammer?
Besides for,
If you're a hammer, everything's a nail. So
keep going through and doing this. Yeah. Like, you know, and there, I mean, a lot of the classes we're addressing different components of this. You know, the body is very, very complex, very, very complex. And so, you know, pretty much everything that we do is unwinding some component on some level, some layer. But this is getting down into the mud, like more so than some of the other classes. You're really getting down into the mud. And so, you know, we're going to do emotional responses after lunch, amongst some other things. We're going to talk about just general allergy care and things. But all of that is very, very helpful. But when everything starts to calm down, in a way, you don't have the distractions too. And so sometimes that's a little bit uncomfortable for a little while. I'm speaking from personal experience. There's times where I see where the story brought me comfort, even though it was wrong. It's like, yeah, but it was comfortable. And you take my story away, it's like taking my blankie away when you're a little kid. Like, yeah, I'll be fine, but at the same time, I'm uncomfortable. You know, and so it passes. I mean, that's the beautiful thing is it does pass. But you sometimes just have to be able to sit with it for a little bit. And everybody has different thresholds with that. You know, and there's no right or wrong. Like, you know, that's the other thing. Don't judge yourself about any of this. You're wrestling with biology. So there is no right or wrong. You're trying to tame a wild animal. That you get thrown from the animal a couple times, it happens. That you ride it out and calm it down really quickly, hey, good for you. Might not happen that way the next time. You really don't know. And so, you know, the best thing you can do is just get in and start addressing it and just do it at a relatively comfortable rate.
Thank you so much for
Yeah,
doing.
you're so welcome. So welcome.
And Heidi?
Yeah, I just wanted to say that I don't think I've ever reached a level of relaxation as I did in that protocol.
Oh, good. So somebody here said she's never felt like she's reached a level of relaxation that she did in this protocol. So, yeah.
We had a good. Go ahead, Narini.
You know, Randy.
Yeah, so I just had a really quick random question, if that's okay. One oil I do use a lot of the time in many different ways, including internally, is helichrysum.
Yeah, yeah,
Helichrysum, and I find that very good. And I've actually just come to running out of it. And I was going through all my oils, and I have Brachypharum. Am I correct that that's from the same family? Is it a
same family, but does not do the same thing.
It's not okay. So this would not have the same.
Not a substitute.
Okay.
Brachypharum is more like rosemary.
Oh, okay. All right. I just wanted to check on that.
Yeah.
The symptoms were gone already after the earlier work. This protocol was peaceful and calm. I didn't notice the symptoms before, but that is because the symptoms are normal in my life.
Yeah, that's beautifully said. We get so used to the symptoms that we just think this is the way that it is. And until they go away or change, you don't really realize, like, oh, that's been bothering me for quite a while.
This last protocol brought some comfort, a new calm in place.
Yeah.
I had that too, not emotional tears.
Yeah, they're like, even like the anger that comes up, it's like a weird anger. It's almost like not even about something. You're just like, ugh. And the tears that you just cry, but if you said, what's it about? You're like, I don't know.
Calm my nausea and feel sleepy.
Yeah, sleepy is good for this.
Dropped the cap a few times throughout those protocols, very relaxed and with everything going on. Middle way felt an internal vibration, interesting sensation.
Yeah. Eventually, we're shooting for almost like a state of non-reactiveness.
I'm physically having a hard time sitting still. My heart is clear, but my body is fidgety.
Yeah, restlessness. Well, we're going to take a break, but we're going to come back and also talk about like the emotional responses and things. So
I'm feeling more balanced.
Yeah.
Knocked out.
Yeah.
Yes, body's been cold this time.
Yeah.
Oh, this whole time.
The whole time.
The body reminds me of a little kid. Terrible twos. No,
Yes, exactly. Whoever said that, perfect. Yeah.
I just had a huge cry, but without like my mouth opening or any violence. I feel better now.
Good.
Extremely strong sneezing now. And then we have a few questions.
Okay.
Will Greg be leading us through pages 5 through 10? Or are those for us?
Yeah, we're going to go back and talk through them. We're not going to do protocols through everything, but we're going to talk about.
What's the spikenard in the bath do?
It calms the whole body. It also cleans up the aura a bit, but it's calming and soothing to the body. It helps to soothe the nervous system.
Can we use valerian in salt baths?
Yeah. Oh, yeah.
This is a non-related topic one now. Does Greg have any suggestions for dealing with a concussion? I fell a few weeks ago and gave myself a moderate concussion. It's healing slowly and no, it's getting better. I was wondering about oils to best support brain healing.
Chamomiles, like Roman chamomile, especially Roman chamomile. Basil can be helpful.
inhalations.
Yeah, you can do the cranial pattern. If you do have the Roman chamomile, take a couple drops internally, but still do the inhalation up on the cranial pattern. Even helichrysum would be good. Yeah. So, okay, so it's about 10 to 1. Let's come back at 2:20 Central Time. So we'll take an hour-and-a-half break and we'll come back at 20 after. Okay, everybody. Hope everybody had a good break and everybody's acclimated to what we did before the break. Let's go up to page 2. So we're going to backtrack a little bit and we're going to go to B under general. So we're not necessarily going to do these protocols, but we're just going to talk about them for a bit. So first off, when you're looking at allergies, you want to look at things that have an antihistamine type property to them, right? And so one of your biggest bets for calming down an acute allergic reaction is blue tansy. Blue tansy is a very strong antihistamine effect. And it could be skin, it could be taken internal, it could be just inhaled. It's a way to calm the body's reactive processes. Long term, one of your best bets is Greenland moss. Over a period of time, Greenland moss can change histamine levels in the body and reduce the allergic response. The allergy support, it is a lot of Neoli with blue tansy in it. It also has a little bit of peppermint and it has a little bit of rosalina, which helps to regulate the neurotransmitters. So this combination, the Neoli is very good for strengthening the response and kind of giving your body strength, while the blue tansy calms everything down. So it's a great way to treat allergies for the acute or for long-term for chronic. Anytime you're dealing with allergies, you want to kind of start treating them preventatively rather than in the heat of the moment. But there's times where it's the heat of the moment and you got to be able to do whatever you can do. So if you have a lot of allergies, blue tansy would be a very good thing for you to utilize for that. Now, sometimes we start to have reactions due to the use of antibiotics. So if you've had several cycles of antibiotics or you've had to be on antibiotics every season for, whatever cold, flu, infection, the tendency is to start having greater and greater allergic reactions. And so if this is the case, different forms of thyme are really good for this. There's a special type of thyme called benchmark thyme. And it's the same type of thyme grown in 4 different regions with 4 different environments, like they surround it by different plants and they grow it in a particular way. And so this isn't something that I concocted. This is something that has been around for a period of time, a few decades actually. And somebody came up with it many years ago. And these types of thyme from the different regions are kind of considered a little bit of a magic bullet to the immune system. When other things aren't necessarily working, thyme is a really good stimulant to the immune system. But when even the dosage of thyme is not working, sometimes the benchmark thyme will actually even work a little bit better. It's a little bit pricey. You don't necessarily need to have it as be your first go-to thing, but if you're really having difficulties, the benchmark thyme is probably the thing to carry and use. Now, balancing metabolism, this isn't necessarily the way you metabolize food, but just your overall body metabolism. When the body is out of whack, when it's out of sync, when everything's just really chaotic. It could be just always dealing with colds, flus, or not colds and flus, but colds, sniffles, mucus, sneezing, hay fever, you're just always kind of seem to be in a state of flux or chaos, then the overall metabolism or environment of the body sometimes needs to be addressed rather than just looking at it from the point of view of a set of symptoms. And so here again, Neoli is on the list. Angelica can be really good for when the nose is running a lot. It can calm things down quite a bit. Here's the difficulty with Angelica, that for some reason, Angelica has become the price of poplar. And it was not always the case, but it has gotten crazy. And so I've been out of Angelica for quite a while, but I went through all my resources. And we found somebody who was selling it at the old price. I bought other things from them, but I'm able to keep the Angelica at the normal price. But pretty much everywhere else that is selling Angelica, for some reason, they have raised the price by probably 300%. And so it's taken me a while to get it, but it is in the US and it will be here probably Tuesday or Wednesday. And so if Angelica is something you want to add to your repertoire, I'll have it for a while, at least at this price. Pomarosa is always good for something like that. Spikenard, that you always have been using for all the different things, can be utilized in immune issues. And so probably best with this is to take it internal. You can try topical, you can try like salt baths and things like this, inhalation, but a lot of times it starts to need to be an internal dosage. Now, cortisone levels. Cortisone, you could also call this cortisol, which is a byproduct of the adrenals. A lot of times when we're under stress for a long period of time, we have too much cortisol. But there are times where you want to increase cortisone. Cortisone is an anti-inflammatory that it's a steroid that produces like an anti-inflammatory effect. And so sometimes when you want to calm down allergies, you can actually do things to increase cortisone levels in the body, the body's ability to produce cortisone. And so with that, things like Sylvester pine works really well, and black spruce works really well. There's also another oil, we're in the process of trying to track it down, called black currant. I've used it in blends in the past, but it's an absolute, there's not a ton of it made. It also is very, very helpful, but Sylvester pine and black spruce work really super well. They keep it regulated. They're not too overstimulating. If the body's achy or inflamed, it helps to reduce that down. Now, sometimes when you're in an allergic crisis, if you utilize the Sylvester pine or the black spruce, it will help reduce the crisis. If the joints are achy, a lot of times it'll take the achiness out of the joints very, very quickly. Now, if you have excessive cortisone levels in the body, not necessarily related to allergies, but if you've had prolonged periods of stress and stress hormones have been in the body, the tendency is for there to be inflammation, and the muscle will actually start losing its tone, like the muscle starts to waste a little bit. And so if that's the case, we have a blend called cortisol reg. It's basically regulating that. Or you could use absinthium, which is a type of artemisia. Absinthium is really good for exhaustion, because basically that's what you're dealing with excessive amounts of cortisol is when you reduce the effects of cortisol, the body is actually in a fatigue state. And so it could be the whole body, or it could be a part of your body. Like for me, I've had multiple injuries and surgeries and things. And so I have one leg that gets exhausted and the other leg doesn't. And part of it is because of when they did surgeries, they had to redirect a nerve in the body, and so the leg just doesn't work like it should, and so that leg gets fatigued actually quite easily. And so with that, one of the ways that you can offset that without it producing lots of inflammation and things is to use the absinthium or cortisol reg. And so absinthium is actually, again, another one that's kind of hard to find. It took me quite a while to run it down. People will make it for a while and then they'll stop making it. But when we found it, we bought up enough to where we're probably good for a few years. So we don't have to worry about running out or anything. The reason also is it's so good for offsetting the effects of stress that it's just, I just found it necessary to have it in stock. So again, if you're wanting to reduce an allergic response, one of the quick ways to do it is to use the blue tansy as an antihistamine and then to increase cortisone for just a period of time. Like the cortisone, you can just do like 1 or 2 applications in a week, and that will probably be enough. If you have a really severe issue, this probably isn't the approach for you, but like kind of acute to medium level allergies, this will actually be kind of helpful. Even in severe allergies, this should help reduce it quite a bit. And then depleted immune response. This is something where the immune system has been run down. Like Narayani was talking about, like trying to build up the immune system over a period of time or strengthening the immune system. A really gentle, safe way, regardless if you have an autoimmune issue or not, is to use Ravensara. Ravensara is very good for harmonizing and strengthening the whole environment of the body without being too overstimulating. And so it's kind of got a balancing effect on the body and the systems. It increases energy, but not like having a couple cups of coffee. It just kind of strengthens the body. And so it's a way to offset depleted immune response without being too overstimulating. Oregano also works. Any form of thyme will work, but like sometimes I don't like to be so super overstimulating when it comes to that. So I'll use something like thyme linalool to stimulate it. Oregano is going to be a little bit strong. It does work, but you'll need to take it in water, and if you make the dosage too strong or you don't use enough water, you'll tell because it is a little bit irritating to the belly. Usually a little bit lower down by the belly button, but it's a little too much. I use oregano, but I use it real sparingly. I use it like when I feel like the immune system's in crisis or I've been exposed to something. I don't use it like a daily basis. And then hypervigilance. This is when the immune system's been overstimulated for a period of time, and you're really trying to calm this hypervigilance down. Not necessarily an autoimmune condition, but it's just over agitated. Again, Maurice, Artemisia, frankincense, mugwort, sweet Annie, and Anua would be in there, but apparently I left it out of the ones. So before we move to the skin, just for general applications, is there any questions?
Yeah, we have a handful of people have typed in, so.
Yeah, fire away.
Okay. The allergy support has which oils?
It has
in
Neoli, it has blue tansy, it has peppermint, and it has Rosalina. And the Rosalina is in there to help regulate the neurotransmitters.
I did not put commas in there, guys. There you go. Can you take Ravensara internally?
Yeah, you can use it topically, but a lot of times when I feel like, I use it sometimes even just for fatigue. Like if I'm traveling and I'm feeling run down, I don't want to be too overstimulated. Like I want to be able to lay down and go to sleep. It might be late in the day. I'll take 2 or 3 drops of Ravensara and water and then drink it. And boy, it gives me energy. And then when I lay down, I just conk right out. And so when I was doing healings every day, back a few years ago, towards the end of the day, from just doing so many healings, it started to feel a little bit of fatigue. When I started to feel fatigue, I would use Ravensara to boost my energy levels, but in a way that was real gentle. It's not like overstimulating or makes you jittery. You just feel stronger. So kind of anything goes. A Ravensara bath is fine. Topical application is fine, and internal is fine.
Is there a difference between Ravensara and Ravensara?
Yeah, they're different plants. So here we're talking about Ravensara, like Ravensara.
How do you use the cortisol, right?
You can put just a few drops on your wrist. You could do a salt bath. You could apply it as a lotion. But just like several drops on your wrist is actually good enough.
They're asking, is Absinthium in the website? I just saw we don't have it on the website yet, so I'll get it on there.
Yeah, we got it a couple months ago, but we made it into some of the products, but we'll put it on the website by the end of the day.
So you already said how to use the cortisol reg and the Absinthium. How do you use it?
Yeah, again, several drops. I'll tell you my favorite way to use it. Salt bath. Oh my God. For me, I take a salt bath in it and then I crawl to bed. Like it just is so deeply relaxing.
And allergy support can be taken internally, ?
Yeah, it can be taken internally. It can be used topically. You can put several drops just on the wrist or inhaled out of the bottle. You could do a salt bath, but because of the mint in it, I would say not the best choice for a bath.
My cat just had a cortisol shot and for her spine inflammation. I kept thinking there was an oil we could have used instead.
I probably would have still, like if it gets that bad sometimes, I would probably still have the shot. I'm not a big fan of cortisone shots. I've had several myself, but when you need them, you need them. They do throw the body a little bit out of whack, but sometimes what they're treating is more important than being thrown out of whack a little bit. To go through and treat and elevate cortisone production in your body, Sylvester pine or black spruce, and coming shortly will be black currant absolute. But honestly, most times I just use the Sylvester pine or the black spruce. I rarely need something stronger than that. You could use that to treat like arthritic conditions, when you have like pain in the spine, when your back flares up. Not necessarily for like when you have a sprain or it's muscular, but like when it's in the bones, when it's in the joints, that's when you really kind of go for the cortisone. And so, the other reason that I'm not a big fan of the cortisone shots, I'm not saying don't get them. I'm just saying use them sparingly, because like I don't think they do it too much these days, but like in the old days, they handed out cortisone shots pretty easily. And what would happen is an area would feel good, but was not healed. And so what would happen is, your body is telling you through pain and inflammation, like, hey, this part of your body is compromised. You get the shot, all of a sudden you don't have the pain and the inflammation like you did, but that part of the body is still compromised. So you go out and you do more things and you keep doing whatever repetitive actions that you're doing, and you keep breaking down that part of the body. And so in the 70s, what was happening is they were dishing out cortisone shots like candy, and athletes would have like a hairline fracture, for example, keep getting cortisone shots, and the fracture would keep getting worse and worse and worse, and they would feel no pain. So they kept pushing it, and it would end their careers because all of a sudden that injury became, irreparable. They basically kind of crippled themselves. Now, if you're getting one shot, that's not going to happen. But if you got 4 or 5 shots over a period of time, like over a year, it's possible that that could happen. And then it does throw the body a little bit out of whack when you have excessive amounts. You know, like when I was young, first I heard you're only allowed 3 a year, and then it turned into 3 a lifetime, and then it was 3 a year, 3 a lifetime. If you have a spinal issue, sometimes the cortisone shot is much better than a surgery. You know, like you have to weigh the circumstances. But you know, in the old days, they used to dish them out pretty easily. And I would say for myself, I had an issue that needed to be addressed. I got several cortisone shots, and because I kept pushing the body and didn't stop or let the body heal or recover, I needed surgeries later because of how badly I had damaged certain parts of my body. And I'd had a lot of cortisone shots. And so is what it is. And so just shake it off and, you know, move on. But these days they don't dish them out that easily. So I wouldn't worry about it too much. One here and there, not gonna hurt you.
How much water do we use?
I would say like 8 ounces, like 6 to 8 ounces.
What did he say is his fave in a bath?
Oh, absinthium. Oh my God, it's so nice.
Again, I'll get that on the site.
Yeah, it's kind of got the smell of wormwood, but even stronger. Like it is the best oil for exhaustion by far. Like if you're exhausted, your adrenals are just run down, you're just, you know, you're tired, or you start calming your adrenals down, you're just like, oh, I'm exhausted. It calms the body down and strengthens the body all at once. It's very calming and soothing to the gut. It's just, it's nice. I actually make a liniment of it and rub it on body parts that are having difficulties. And I mean, I'll do it once or twice and then I'll forget about it for a couple of weeks because it feels that good. The very first liniment ever made, you know, way back in ancient times, had absinthium in it. And so, you know, they recognized it for its ability to accelerate the healing process and to deal with exhaustion.
Greg once named an oil called Anula. Is it good for allergy?
Anula is good for mucus, but not necessarily. It's not necessarily something you would treat for allergies. It's used to break down mucus. So if you used it and you had mucus, yes, it would be good, but it wouldn't actually impact allergies. It would just simply be for breaking down mucus.
Is hypervigilance what we were working on earlier today?
It's yeah, this is a softer form of it. Yeah, like if you really were trying to knock it out, you would do what we did right off the bat. But sometimes you're just trying to do a slow, soft version of it. You would do this hypervigilance. That's number 6.
For the future for that cat, would you say that using Sylvester's pine like on the spine of the cat instead of the cortisol shot?
Yeah, it depends on how bad it is. I would probably take a few drops of the Sylvester pine, mix it in with like a little bit of alcohol, and you could rub it on the spine. Yeah.
I'm not sure what this is in reference to. You might know. I'm just going through the questions. What about Sitka? I think
yeah, Sitka would actually work. Sitka does have an effect on increasing cortisone because it is in that spruce family. It is different than black spruce because of the region and the area that it grows in, but it still has an impact on cortisol. Producing cortisone. I would still go to black spruce first and Sylvester pine, but if you had Sitka, you could use that.
One of my friends has a tear in her knee and she has to take cortisol shots every 6 months. can she use the Sylvester pine to help?
Yeah, you could try to use this to offset that and maybe get more distance in between the shots. But if she has, I don't know if you're talking about a meniscus tear or an ACL tear, but meniscus tear, it's not going to heal. You know, it's cartilage, and so cartilage doesn't have its own blood supply. So it's a lot like your teeth. You know, once it's damaged, it's just damaged. But you can reduce the inflammation and keep things down and make it so that it's non-surgical. But yeah, you'll have to maintain the inflammation over a period of time. So lymphatic oils for that area, anti-inflammatory oils like yarrow or German chamomile, milfoil. Milfoil is really nice. It's a form of yarrow. It's anti-inflammatory and has a very strong antispasmodic effect. That could be rubbed on as an ointment. And then still like maybe 2 to 3 drops, you know, every couple of days of the Sylvester pine or the black spruce, and that should help reduce inflammation. I would also put that person on black cumin internally, like 2 to 3, even 4 drops a day to keep the inflammation down. The more you can keep the inflammation down, the better. You know, the inflammation starts to thicken and cause other issues when it's been there for long periods of time. So anything that's been inflamed for, you know, more than 30 days, you really need to double down on trying to get the inflammation down. You know, that's for me, like I'll just give you an example. This is excessive. So this isn't going to happen for most people, but I was doing a repetitive motion and there was a lot of inflammation in this particular area, and it got so thick that the inflammation formed its own, like it thickened and formed its own blood supply and turned into tissue. And so they actually had to go in and cut out inflammation that had actually its own blood supply. And so tendons and sheaths grew together, and that compartment, you know, basically that inflammation started crushing everything in that compartment. And so that doesn't happen to most people. That's usually repetitive motion or really high level of force, like, you know, a lot of weight bearing stress on a particular joint. And so I wouldn't worry about that, but inflammation over a period of time starts to inhibit how a tendon and sheath like works together. And so like when you're moving, your tendon is sliding inside of a sheath, and when things get inflamed, the inflammation starts to get thick and kind of sticky. And so what happens over a period of time, it just starts getting easier and easier to irritate that tendon. And so good to flush it out. You know, German chamomile, yarrow, blue tansy, milfoil. Milfoil works really good for that. German chamomile is very good for dispersing inflammation in the body to other areas, just to flush it out of that capsule or that area. And so that Inflamend, you know, that blend that we make, that's basically all those oils put together. And so the black cumin is a good way to do it internally.
Is angelica the same as angelica root?
Yeah, it's the same. There is an angelica seed that floats around, but it's starting to be like Bigfoot. Like I have some just in my old catalog, but it's not really around anymore. Like you can't really find it. So it's starting to turn into like an old kind of myth. Every once in a while you still see it around, but angelica has gotten significantly harder to get this last like 18 months. It happens with plants sometimes. You know, sometimes there's been a bad season. You know, like there'll be a year where there was no roses, or you know, something happens, you know, especially out of a particular region. And so hopefully this is short term and not a long term issue, because angelica is amazing. We're chomping at the bit to get it in, because I've been having angelica drought around here, and I love me some angelica.
Do you take benchmark time instead of antibiotic or with an antibiotic? For
Depends on
allergic
what it
reaction?
is. I mean, I never want to tell somebody don't take your medication or your antibiotics, but a lot of times I try taking natural substances before I end up having to take something like an antibiotic. It's been a really long time since I've had to take an antibiotic. I think the last time I took an antibiotic was they gave me a shot when I was having a surgery. And so time is very good for jump starting the immune system, but it really depends on the health of your body and what you're fighting off. Like, you know, if you're just dealing with a cold or a flu or something, you know, and you can use something like thyme and oregano and Ravensara and you know, strengthen the body so that, you know, you're not looking always for the immediate quick result when you're doing something holistic. You're looking at how is the body going to be after this condition. I want the body to be stronger and better after going through a flu or a cold than being depleted in a weakened state. And so, you know, that doesn't mean that like using the oil is going to eradicate all your symptoms in, you know, 12 hours or 24 hours. But you come out on the other side much stronger, much better for it. But there's times where the infection might be quite substantial and potentially life-threatening. And in that particular case, you know, it's just one of those times where you got to do the medication. And so, you know, I would. And so I never have a completely prejudged way of how to handle it. I kind of evaluate it case by case. And, you know, if it's just about comfort and getting it over, I usually don't take the antibiotic. If it's potentially life-threatening or something that can potentially escalate and cause other serious health issues, then I would take the antibiotic. You know, they have their time in their place, and so I would just say case by case basis. Keep your system strong as best that you can, but if something comes up, you know, evaluate.
Can you please type the name he was talking about? I think it's Absinthium, and I think I spelled it right, and I just pasted it there in the chat for you there. What's good for wheezing? I don't know if it's allergies.
Yeah, so wheezing can be allergies and it could be asthma. And so with wheezing, there's a section there for asthma. I'd start off with probably hyssop decumbens would be your best go-to bet. And I would take quercetin, which is listed down below in your notes under supplements or herbs or whatever it was. And I would take 3 capsules probably 2 times a day. You could spread it out more and do two capsules 3 times a day. But if it was induced by exercise, I would take fish oil.
Will you have Absinthium with you next weekend? Yeah, we'll bring it with
Yeah,
us.
sure. Yeah.
Did Greg say milfoil is anti-inflammatory or
Yeah.
antispasmodic?
It's both. It's both. Very anti-inflammatory, very antispasmodic.
I'm just trying to do the related questions, guys, just so you know. And Cynthia is not on the site yet, guys. I'll get that up by the end of the day.
Apologies.
I'll do it on one of the breaks.
Yeah, we'll get it on today.
Can you take black seed complex internally?
Yes, it's meant to be taken internally, actually.
And I think we'll address the non-related questions.
Yeah,
at the
we'll
end.
do the non-related at the end of the day, just to minimize confusion. Okay, so now let's jump into skin. And again, we're not going to do necessarily protocols, but we're going to just kind of talk about some of the things so you can go through and address. Now, many years ago, I did a kind of a preliminary study on chronic allergies, and we had 102 patients over a period of time. And we looked at a whole range of allergic reactions. Sometimes it was respiratory, sometimes it was digestive, sometimes it was skin. And when we went through and we looked at the triggers were always relatively the same, but the manifestations would be different from person to person. And so a lot of people in the study had digestive issues, but we had a significant amount with respiratory issues, and the smallest amount was skin-related issues. And one of the biggest triggers for digestive issues was actually the skin. The skin, poor lymphatic function, nerve innervation to the internal organs, and then the tension in the diaphragm. And so when we're looking at skin, we want to go through and be able to treat the skin. If you're trying to keep your immune system strong, part of keeping your immunity strong is actually the treatment of the skin. If you have any sort of allergic reaction, you have a skin issue, even if it's not eczema or a rash, you're having some sort of a skin issue. And it's poor lymphatic movement, it's poor, it's not acting as it should for being a barrier. Outside invaders are getting in too easy, or it's hyper-reactive. It could be any version of this. And so let's go through and talk about some of these different versions. Okay, so skin congestion. So skin congestion, the easiest way to diagnose or evaluate, I should say, skin congestion is when you go out and exercise, you should perspire, right? Skin congestion, you exercise and exercise and exercise, and you perspire very little or not at all. And so the pores are they're blocked. And so what happens is you do things that would cause perspiration, and then instead of being able to perspire, your body is just holding all of that in, and the body becomes toxic. Anytime the body is not able to detoxify, which is through the skin, anytime the body's not able to detoxify through the skin, it starts to impact the internal organs. Like when you go through and you clean up the skin, right off the bat, your kidneys, liver, and spleen start detoxifying the system without you doing anything else. And so when the skin is really super congested, you're more prone to achy joints, you're more prone to fatiguing faster when exercising or doing activities because you have a buildup of lactic acid. And you become more hypersensitive. So one of the very, very best things for skin congestion is either helichrysum or milfoil. And so like when I was traveling with cycling teams, for them, like the faster they can warm up, the better that they perform. And so warming up before exercising or before a sporting event is usually you're going out and you're doing some light exercise trying to break a sweat. And so I would put several drops of milfoil on their wrist, and then I'd tell them to go warm up, and they'd come back in like 5 minutes and they go, boom, I'm warmed up, I'm ready to go. And when they would do that, they would have really good days. They would perform at the peak of their level. It didn't mean that they were winning the race, but they were doing really good for them, And so Roman chamomile also works, but my first go-to oils for this is helichrysum and milfoil. You can simply just take a couple of salt baths with either helichrysum or milfoil, and a lot of times it's not even a lot of applications. You can do it in just a few treatments. And if this isn't working, then you can try doing a liniment or a lotion, cover the body, and the next time you go out, you'll notice that you're actually perspiring. So pay attention to your perspiration rates. If you're not perspiring, it's actually an issue. A good tonic for the skin, not necessarily for perspiration, but just to keep the skin healthy, is parsley. Parsley is really super good for the skin. So parsley baths are strengthening to the immune system. They keep the skin healthy. They keep you detoxifying regular. But when you start dealing with skin congestion, you got to take it a step further. Right now, eczema. Eczema is just like those little dry, flaky rash areas that, sometimes you get them behind your ear. You'll get a little spot or a patch on somewhere on your body. One of the best oils for that is Kunzea. The Australian equivalent to the FDA actually recognizes Kunzea as a viable treatment for eczema. And so people can actually put it on products that this is for eczema and sell it in the health food store in Australia. And so Kunzea can be put on with lotion or massage oil or just direct. Hives. They're like these little red spots, welts. Ravensara usually helps knock that out. Sometimes I've given a person quercetin, which is, a crude form of vitamin C, but hives a lot of times can be knocked out by Ravensara. And then you have the different versions of bites. Like if you get mosquito bites, they get inflamed or something like that, that's still actually an allergic response. Many years ago, there was an outbreak of bed bugs on the East Coast. And I was getting all these phone calls for people that have sessions. And basically, we just put them on quercetin. I didn't even do healing sessions on them. I was just like, just take a couple of dosages of quercetin. And they were actually having a reaction to the bites from the bed bugs. And so anytime there's a bite, it is an allergic reaction. And so the way to calm that down is you can apply these oils on topically to the area, but you can also go back to using antihistamine, like blue tansy, something like that, and try to reduce that through inhalation or a few drops internally. Even just taking a Benadryl will actually a lot of times knock them down. But you can do a neat application, putting it on a particular area, or you can do a compress, which is like a little bowl of water and not super hot. You're wanting this to be kind of room temperature or even a little bit on the cool side. Put 5-6 drops of that in, stir it around, and then take a paper towel and dip it in, and then keep putting it on the bite. And you'll usually find relief within a few minutes. It will calm it down quite substantially. If you're on the go, you can just put a few drops on a neat application. And so bee stings are the same thing, wasps and hornets, they can actually get quite inflamed. And so that you might need to treat for a period of time. And that one you might actually need to do compresses with. The other trick with like wasp and hornet bites is say you're out and about and you don't have access to your oils, and find some mud and put the mud on it. And the mud will help draw out the poison and calm down the inflammation. You still need to clean that out and wash that out later, but the mud is a way to do a little first aid on the scene. Where I grew up as a little kid, we had really bad wasps and hornets, and they would be on the ground, like in the lawns, and so you'd step on them and get stung, or you get stung by half a dozen of them out playing or whatever. And so mud was used to instantly take the sting out and the inflammation. So before we move on, any questions with skin-related issues?
Yeah. Can milfoil and bay laurel work the same way for skin and anti-inflammatory issues?
Where are you seeing that?
I don't know. They asked about, can milfoil and bay laurel work the same way? I asked in relation to the skin, because we were talking about the skin. They said skin and anti-inflammatory.
Bay laurel is better at like breaking up the lymph nodes, and milfoil is a much better anti-inflammatory, like significantly better. So I wouldn't even put them in the same category, to be honest. Bay laurel is really good for breaking up lymph nodes, you know, and joints and things like that, but it's a different part of the inflammatory process. So reducing the inflammation itself is the milfoil, reducing the effects of the inflammation, which is the lymph nodes getting sluggish and not functioning properly, is the bay laurel. So I think that's where you're making the connection. And so it's kind of a good 1-2 punch, but they're not really things that you could substitute for each other.
In the salt bath, can you mix the helichrysum and absinthium?
Oh, yeah. I think that would actually be delicious. I think on a break, I'm going to need to go take a salt bath.
It was the helichrysum and absinthium.
Yeah.
Is perspiring too much a problem?
Perspiring can be too much. I mean, perspiring too much can be a problem. And so that is the flip side of it. A lot of times you'll see that on the armpits, but you also see it like on the hands and soles of the feet. So with that, you have a couple of choices, right? A couple of choices. One is you can start using cypress. And with cypress, you would take that internally, right? You like a couple of drops in water, like once or twice a day. The other one is you would use sage topically, right? So if there's excessive perspiration, you could put several drops on the wrist. You could, you know, rub it in as a lotion. You could make it a liniment. You could take a salt bath. You know, any form of that should help reduce excessive amounts of perspiration. And this would include when people are going, when women are going through menopause and they get night sweats and things like that. The sage should reduce the night sweats. Yeah, some people will just naturally like sweat a bunch, but if you really look at them, it's a lot of times the armpits, palms, and soles of the feet. And the cypress, and we'll usually calm it down, and if that doesn't work, then the sage.
I get spider bite reactions. What is helpful for that?
Yeah, so same as like the mosquito bites and bee stings. The same thing. Yeah.
Anything good for ticks?
Okay, so ticks. This is what I would use for ticks. Like when you say you go through and you find like, I have a tick, or the dog has a tick or something like that, put a couple of drops of, don't try to get it out, put a couple of drops of peppermint on the tick site, like on the tick itself. And if you give it a couple of minutes, the tick will actually back itself out. So you don't need to pull it out. It will back itself out, and the peppermint will actually kill the tick. And so then after that, if you need to clean up the site a little bit, you can do the things here where it talks about like the blue tansy, German chamomile, things like that. If you just want to clean it up, you could put tea tree on it, like on the site itself. But peppermint will get rid of the tick and get the tick, you know, basically to back itself out. It's amazing. It's truly amazing to watch it. Like you just put a couple drops of peppermint on and problem solved.
Can the Ravensara for bites be applied neat?
No, it's not for bites, it's for hives. Yeah. It's probably best either internal or like on a lotion. You're not necessarily going to put the Ravensara directly on the hive itself. You need to bring the body back into a sort of balance of sorts.
Is milfoil in any of the pain blends?
I do not think so. I think it's in actually the anaspasmodic blend, if I remember right.
If you cannot take a salt bath with parsley due to septic issues, how else can you use it?
Put it in a liniment or a lotion, and then just rub it on the body from time to time. You know, liniment being like alcohol based, and then, you know, spray it on the body and just rub it in.
Can parsley be taken internally daily indefinitely?
Yeah, it can. Very good detoxifier.
So are there some oils good to use for bad skin, like rosacea on the forehead?
Rosacea, there's not really an essential oil that's too great for rosacea. I have some notes on rosacea somewhere, but they're not here in the allergy class. I'll try looking them up at some point.
Can you apply helichrysum on your wrist similar to milfoil to help with sweating?
Kind of, but if sometimes when the skin is really congested, you have to kind of cover the whole body. That only works when the skin is not congested. You know, so for the athletes, we were just trying to help them break a sweat because that was a diaphoretic. And so when you have congested skin, the milfoil and the helichrysum need to cover a majority of the body. So bath is good. Even if you can't do a salt bath, just do a regular bath. You could do a bath or rub it all over the body with mixed in alcohol or a lotion.
These last two, they're a little off of just the allergy one for the skin, so we'll go back to those afterwards.
Okay, yeah. Okay, so let's try covering a little bit more. Hay fever. We're jumping now to D down at the bottom of page 4, respiratory tract. So hay fever. Hay fever, I mean, I think everybody kind of knows what hay fever is. Watery eyes, sneezing. At this point, if the blue tansy hasn't worked it out, sometimes the hyssop decumbens will actually help eradicate it. The thing is with hay fever, it can be something that's different from person to person as far as how to treat it. And so, you know, a good starting point is hyssop decumbens. Hyssop decumbens is better than just regular hyssop in this particular case. So that's why it's not just any hyssop, but it's a good jumping off point, and you know, it opens up the chest, it opens up the sinuses, it relaxes the diaphragm, and it kind of can take you out of that state. But sometimes you might need to combine it with blue tansy as well. Next with the respiratory tract is the issue with allergies can be like from the straining to breathe, the coughing, the sneezing, it throws the diaphragm into spasm. The diaphragm being in spasm also will cause food sensitivities in the gut, and it will also cause toxicity levels of the gut. And so going through and unwinding the diaphragm can be really important for the treatment of allergies, especially gut-related issues or respiratory-related issues. So again, the hyssop decumbens, regular hyssop, Sitka, but Omnibus Naga is probably the one that really shines here. But any of them will work, you know, any of them will work. Just by doing long, slow, deep breaths, you don't even have to do a pattern, should start to unwind the diaphragm. Hyssop decumbens, I gave several people after they had serious cases of COVID, and they were still having respiratory issues, and we unwound a lot of the symptoms with hyssop decumbens. Now, as you're struggling to breathe, you have actually skeletal muscles that help to elevate the rib cage. And when you've had to sneeze a lot, cough a lot, or strain to overcome mucus, these muscles become tense or aggravated. You know, it's like how you would get a back strain. You could get a strain in some of the respiratory muscles that aid in your respiration. And so with that, you see Rosalina, marjoram, or hyssop are all very good for overcoming those issues. Traditionally, I've mixed marjoram and Rosalina together. And if you're dealing with a child, mix the Rosalina and Spanish marjoram together. The Spanish marjoram works much better for a child under 8. And, you know, put in a little bit of massage oil and then just rub it on their chest and neck and their back. And it really helps to open up the chest. Helps quite substantially, actually. And so it allows them to breathe easier and not have to strain, and they don't have the difficulties. A lot of times what it is the diaphragm and the neck muscles work together to elevate the rib cage, and they'll start going into a spasm. And so they'll start to have a short, rapid breath, which makes it harder to breathe and starts to produce anxiety. So it's actually quite relaxing to go through and do this. Excuse me. Now, chronic coughs. Chronic coughs there's lots of different kinds of coughs, but when you just have this like low grade kind of cough, that's a spasmodic cough, or a cough that's just like a tickle in the throat, one of the best things for that is myrtle. It can be due to allergy, it could be through postnasal drip, it could be all kinds of reasons why you're getting it, but myrtle will usually resolve that issue. And so if you just have this low grade kind of cough that's not a big cough, but just a, all the time, myrtle can be used to resolve that. And again, it's just inhalation. Just open up the bottle and take long, slow, deep breaths. You could apply several drops to the chest in a massage oil or lotion, and just let the vapors kind of keep going up through the nose. But a lot of times that will resolve that. Sinus congestion, inflammation, there's a whole bunch of things that are listed here. This is, again, to break down the congestion, to break up the mucus. Sometimes this can be allergies. Sometimes this could be stress oriented, or sometimes it's just a byproduct of like a cold. But all of these will work for any of the reasons why you're getting congestion, but we're putting it here for the sake of dealing with allergies. If you're just constantly dealing with thick, heavy mucus in the sinuses, eventually that will turn into a sinus infection. Mucus is, excessive amounts of mucus is a breeding ground for bacterial infections. And so you want to keep that to a minimum. So again, just long, slow, deep breaths. Nothing crazy, no pattern, just long, slow, deep breaths. Before we deal with asthma, with the little segment that we just talked about, is there any questions or comments?
Well, someone, maybe it'll be a little later, but the itching eyes caused by allergies, would it fit in this area?
Itching eyes. Yeah, I would say the itching eyes would probably go away with the antihistamine, with like the blue tansy, something of that sort. I would probably go to that route. You could try the hyssop to come in under hay fever, but I would start right off the bat. Your very first thing with allergies would be to target the antihistamine effect. Just calm everything down.
That go for animals as well, like for dogs that has watery eyes and sneezing?
For dogs, I would probably actually use basil. I would use basil. Okay. Yeah, like rub it along their spine. Okay, so now let's tackle asthma. Okay, with asthma, we're looking at different symptoms. So it's not always a cookie cutter approach that can be utilized for the treatment of asthma. Sometimes it has to be personalized from individual to individual. So let's talk about the components, and then you can see the things to explore. Okay, so one right off the bat is inflammation. You're dealing with inflamed lungs, inflamed bronchioles, just the whole respiratory tract can become inflamed. So that means poor muscle tone and poor respiratory function. And so these oils, through sustained inhalation, can be very beneficial. Almay visnaga, lavender. I tend to like Roman chamomile and sage personally, but you know, any of them will work. And so if you're not finding relief with one, you can kind of rotate them a little bit. Pine is really super good for the respiratory tract. Pine is really super good. Now, when we're dealing with tension in the smooth muscle, this would be the spasms. So it can be inflamed and also have spasms. Anise and anise seed myrtle, always very good because they're very good at relaxing smooth muscle. But again, one of the big standouts here is Almivus nigra. Spikenard can be helpful, tarragon can be helpful. All the ones listed there are, you know, A choices. And so you're reducing the spasms in the bronchial, you know, the bronchioles, so that you can take a deeper breath. So, you know, each component needs to be treated, and you can combine them a little bit, but a lot of times I do them individually. And then mucus. Mucus can actually start to thicken and harden a little bit, and there can be a layer in the lungs. You know, it could be that you're dealing with heavy, thick, moist, or heavy, thick, sticky, you know, any version of that. Anula is one of the best mucolytics there is in the aromatherapy toolbox, but it's a bit pricey, right? A really good mucolytic that really helps clear up mucus in the respiratory tract, that's very inexpensive, is terebinth. Terebinth is, I mean, amazing when it comes to mucus in the respiratory tract, and it's not expensive. And so usually I start people out on terebinth. Eventually, you know, either in a blend, I'll put Anula, or in really severe cases, I'll use Anula. But a lot of times you can get by with the terebinth, and it rocks it for, you know, basically 20% of the price. And so terebinth is a good go-to choice. You know, we think of it as something for like joints and you know, arthritis and things like that. Incredibly good for the respiratory tract. And so you can just take long, slow, deep breaths with it, and it will just keep breaking down the mucus, keep breaking it down, breaking it down, breaking it down. Now, sometimes what happens with asthma is there's some emotions associated with it. So this is emotions that are caught in the chest or associated with the respiratory tract, that as you try to treat the short rapid breathing associated with asthma, and emotions start to come up or start to reduce the efficacy of what you're doing, you know, because the emotions are coming up. These oils can be good go-to oils for it. And you can see we're having a lot of similar oils for these different conditions. So a lot of these oils will treat multiple things within these parameters, but I'm trying to give you different things to look at so you can fine-tune your approach. Now, when somebody has asthma, I treat them with essential oils, but one of the things I do right off the bat is I put them on quercetin. Put them on quercetin about 3 capsules twice a day. If they're real small, or a child, I reduce the dosage, you know, to maybe 2 capsules twice a day, but 3 capsules twice a day. And then I put them on 400 to 500 milligrams of magnesium a day because of the antispasmodic properties to them. I usually put them on 500 to 1,000 milligrams of garlic, you know, deodorized garlic. And if it's really severe, I also put them on 3,000 milligrams of cordyceps. Now, everything that I just said is in your notes. It's already written out for you. It's down in the whatever it says. What does it say? Herbs or supplements or something. Yeah. So all these things are written out for you. So basically, all of the things that are there are for allergies. my best results in treating asthma has been with quercetin, magnesium, cordyceps, and then a few of these oils, using essential oils as the inhalation. Now, when they have asthma, sometimes if you inhale something really quickly right off the bat, it's too much. So you have to let them get used to inhaling some of the oils very slowly. A good example would be eucalyptus. If you stick eucalyptus in front of somebody with asthma, they'll take a long, slow, deep breath, and it will almost start like a coughing fit. So if you let them just gently start inhaling the eucalyptus, eventually the eucalyptus could be used to heal the asthma, but at first it might be too much. So you have to use it kind of sparingly. In the old days, what I used to do is, instead of having them inhale it, I would actually start by applying eucalyptus to their back, like the area between their shoulder blades. So you're getting the benefit of the eucalyptus. They're getting a little bit of the smell, but it's not overpowering. It's not overstimulating. So, any questions on asthma?
A couple of people are wondering about terebinth internally.
Yeah, I don't know that there's a big benefit for allergies and things like this for that. I would actually do more inhalation. If it's exercise-induced asthma, include fish oil. That's usually a fish oil, a deficiency the fish oil eradicates. Okay. So now let's jump into the digestive tract. Now, sometimes we're having allergic responses because the friendly bacteria is too low and the obnoxious bacteria, I think that's a medical term, obnoxious, just the bad bacteria, and there's just too much of it, right? So your new best friend, if this is the issue, is Palmarosa. Palmarosa, taken internally over a period of time, will actually grow the friendly bacteria and diminish the negative bacteria. Somebody wrote a paper and said that it actually transmutes the negative bacteria into positive bacteria. I don't know that that's the case. I think the bacterias are different, and I think what they're trying to say is it diminishes the negative and increases the positive. So we'll leave it at that. Now, tonic just simply means you can use this for a period of time just for a toning effect on the digestive tract. Not necessarily to treat a specific thing, but you're just trying to keep the digestive tract, in good, nice, healthy function. So any of the seeds like anise, caraway, fennel, those are all good. Spikenard is actually really super good for this. It calms down a nervous gut. It is helpful when there's imbalances in bacteria and enzymes and things like this. It's helpful when there's inflammation in the body. It doesn't really cut the inflammation completely, but it helps. Spikenard can be taken internally and be a lot of benefit to the digestive tract. We have digestive support in the 4 seeds. Those are both traditional blends that are used as a tonic. Diarrhea, things like cassia and cinnamon have been used to treat diarrhea. One of the ones that I use for diarrhea actually is galbanum. It's not always immediate, but it seems to kind of regulate that and make it go away over a period of time, take some of the tension out of the gut. Cinnamon does eradicate it somewhat, but yeah, I tend to do galbanum myself. Allergic reactions to foods. There should be no reason why your immune system is reacting to food when you eat it. And so if that's the case, one of the things that's nice is Melissa. Melissa is an antihistamine. I didn't include it in the list just because it's not super practical. Melissa is very expensive. And so those other choices were better choices, and you can use it as an antihistamine. It's just, it's an expensive antihistamine. Blue tansy is probably a little bit better as an antihistamine, but Melissa will work. But here it also is very soothing to the nerves. So you have the antihistamine effect, and you also have the impact that it has on the nervous system. It's calming and soothing to the nervous system. It calms down an agitated nervous system. And so here, if you're having that issue, this is a lot of bang for your buck. A lot of times you don't have to take it daily. You can just take it from time to time, and it's very, very helpful. Melissa's very soothing, by the way. And then food sensitivities, here I just listed, you're going to have to go through and basically combine releasing the diaphragm, working on lymphatic movement, which we're going to be talking about next, skin congestion, which we talked about at the beginning of the skin segment, and then do the whole protocol for the autonomic nervous system out of this booklet. Not out of another booklet, out of this booklet. Okay. So how are we doing so far? Any questions with what we got going on so far?
What causes diarrhea?
Oh, there's all kinds of causes. Yeah, there's all kinds. It can be, autonomic. It could be toxicity. It could be inflammation. Could be an infection. Could be emotions. I mean, there's lots of causes for diarrhea.
Does food allergy include milk allergy?
Yeah, any sort of reaction to food. Yeah.
Someone said, what is the tonic good for? I missed that.
Tonic is just to tone the system and try to prevent, future issues. You're just trying to keep something regulated and strong. Yeah, I think we're good. Okay. How about this? Let's just take a little 15-minute break. We'll come back and we'll talk about the lymphatic system and autonomic system, and then jump into some of the emotional components. So I'll see you back at 1:45. Page 8. And again, we're just going to talk about the lymphatic system for a little bit, and then we're going to move on. So in some of the previous classes, we've had different versions of treating the lymphatic function. This is to be very specific for the inflammatory response and the allergic response. And so it's a little bit different than what's in some of the previous classes. So first off is tension. It's actually spasmophilia. So the basil, neroli, petitgrain, all super good for spasmophilia, but the blend spasmophilia definitely shines here. Now, what is spasmophilia? Spasmophilia is your body begins to go into a spasm with a moderate amount of stimulation. So it could be movement, it could be prolonged sitting, it could be prolonged emotions, it could be having to breathe real hard or deep for a period of time, and all of a sudden the body starts to go into spasm. Now, part of what you're doing is by calming this mechanism down, you are allowing for greater lymphatic movement through the body. Like this kind of tension in the body is tied directly to lymphatic function. And so it's basically overstimulating to the sensory nerves. Whenever the lymphatic system is backed up, the sensory nerves become very overactivated. Now, another condition where this happens is actually in chronic fatigue and fibromyalgia. And so you could use this to help offset, some of the symptoms of chronic fatigue and fibromyalgia. But first off is you're treating. You can do inhalation, but a lot of times what I do is over a period of time, I treat it topically, either like a salt bath, a liniment, a massage oil. I don't do them all at once, but I do them kind of consistently. Like I'll put number 1 on, and then I'll do number 2 a little bit later, maybe a few hours or at the end of the day. And then the next day I'll do number 3. And then, at the end of that day, I'll do number 4. And so you can do any version of that. If you just want to fire through them and do the breathing, that works, but sometimes deeper is actually applying it to the body. Okay, so first is tension. Next is just your good old fashioned lymphatic circulation. So the lymphatic blend, there's some single oils that kind of work, but really when you're needing to stimulate lymphatic circulation, it's best to utilize a blend for this because there's so many different components to the circulation. There's no one oil that really will do it all. Okay, then deep lymphatic movement is starting to go deeper into the internal organs and then deeper towards the bones in your body. You know, you have a superficial circulation and you have a deep circulation, and so sometimes the issue is more superficial and sometimes it's the deeper aspect. So here the blend charcoal root cleanser is actually made for deep lymphatic movement, right? Then the very last thing is you're wanting to now go through and treat deposits in the joints. So this could be basically any material that needs to be picked up by the lymphatic system and flushed away. It could be in the joints, it could be in tissue, it could be in the abdominal cavity. It's not necessarily in the joints, but usually that's where it manifests. But for example, like some people who get trigger finger, they actually have deposits in the forearm. It's not in the joint itself, it's actually in the forearm. You can have deposits in your gut. And so by going through and doing this protocol on a particular area, you know, if you rotate through the four, like I think I was 22 and I was told I was going to need to have surgery again on those parts of my body within 2 years, or I'd have a difficult time standing. And, you know, that was a very long time ago, more than 30 years ago. It's more than 30 years ago. And through doing this repetitive lymphatic circulation and just always keeping everything moving, not only have I not had the surgery, as it feels better than it's felt in a very long time, even as I've gotten older. And so it keeps the inflammation down and keeps the body's ability to heal heightened. So not only is it making it so that I don't need the surgery, it's actually feeling better and better. Like it feels better now than it did 6 months ago. And so don't underestimate the use of treating the lymphatic system for just about any health issue. I mean, the lymphatic system always needs help, always needs work, okay? The autonomic nervous system is basically your involuntary part of your nervous system. And so a lot of times with allergies, the allergies is the immune system and this, right? And so we did kind of a 1-2 punch before lunch. We didn't do the first part, but we did do the second part. Basically, what happens is the nervous system doesn't always innervate the gut, for example, like it should. And then the gut doesn't function like it should. The main byproduct of that would be food sensitivities. Food sensitivity is almost always neurological in my experience. And so when you go through and you treat this first component, you're calming down the tension in the smooth muscle and you're helping the nerves fire to that part of the body. It's a lot like having a foot that's asleep. You know, you sat on your foot and it's fallen asleep and it's hard to move it. It's hard to put weight on it. The same thing happens in your gut, but you're not aware of it because your smooth muscle in your gut doesn't have the sensory nerve endings that your foot does. So you're really not aware of it. And with that, if you go through and treat this over a period of time, between unwinding the diaphragm, doing lymphatic movement, and the autonomic nervous system, cleaning up the skin, a lot of times most allergies will diminish and go away. There was several people when I was doing that study that they didn't even have to eat the food. They could just touch the food or be in close proximity of the food, and they would end up in the hospital. And within 6 months to a year of treatment and, you know, having some time for incubation, not only would that not happen, they were actually eating the food once or twice a week and no reaction. One of them was a nurse. And so, I mean, she was on top of it like nobody's business. And yeah, I just had communicated with her about 6 months ago. And I asked her how the food sensitivity was going. And she said, you know, every once in a while, she goes, I feel like I need a tune-up. And then a year goes by and I go, well, I should probably get a tune-up. I mean, it's not bothering her. Where before, I mean, if she was even in proximity of the substance, she would end up in the emergency room. And so this is pretty straightforward. I want to be able to jump down into the emotional components. So let's do this. If you have questions about anything that we covered before the break or after the break, let's go ahead and have you ask some questions.
In relation to that.
Yeah, let's keep it in relation to the class, just so people don't get confused. At the end, I'll answer other questions.
What's the difference between lymphatic blend and chocolate root cleanser?
Lymphatic blend is more the superficial lymphatic circulation. Chocolate root cleanser is the deep. So they're targeting two different types of circulation, basically, or two different components of the circulation for the lymphatic system. Okay, we're good. Hypervigilant immune response.
We have one question, sorry, it just came.
Yeah,
up.
go ahead. Go ahead.
How does peanut allergies fall in all this?
I don't understand.
Are that you wondering how to treat it? The peanut allergies? Are they the same as other allergies?
Yeah. Yeah, an allergic response is an allergic response. So, you know, you're going through and you're re-educating through all the steps that we're talking about here.
This one actually. What's the difference between a food allergy and a food sensitivity?
Food sensitivity is usually more neurological in nature. And a food sensitivity, or excuse me, a food allergy engages the immune system when food's ingested. You probably wouldn't know the difference, but technically one's the immune system responds and the other one is poor neurological innervation to the gut.
And would Melissa work for celiac disease?
Celiac is a whole nother ball of wax. It's not going to be something that's simple as taking a simple thing. That is, we'd have to do a whole day class on how to treat celiac. Yeah, like that's a complicated thing.
Is it treatable?
Yeah, I've never achieved a complete cure, but we definitely have knocked it down quite substantially, or at least made it like relatively manageable. It depends. A lot of the celiac cases that I saw were in Down syndrome children. And so they're just super predisposed to celiac, and you know, their immune system is so poor that it usually shortens their lifespan. And so you know, we were trying to do our best to keep them as healthy as possible and extend their life as long as we could. You know, I was never able to make it completely go away. There's a genetic predisposition. You know, not all the cases have a genetic predisposition, but for Down syndrome kids, that was the case. I only treated probably about 50 or 60 cases of it. So it sounds like a lot, but for me, like I feel solid when it's over 100.
Someone has a question that not type in, they want to verbally ask it. Is that okay?
Sure, go ahead.
Go ahead, Tracy.
Hey, I thought this might be a little bit too much to try to type. So I've been taking the black cumin, and when I take, so I have two kinds. I have the essential oil and I have capsules.
Mhm.
And what I've noticed is when I take like the internal taste, I mean, the oil is really good, but when I take the capsules, it actually helps my digestion. And I wondered if it was because it's a different delivery.
Yeah, it could be the delivery system. You're getting it probably in like an olive oil base. And so is it powdered or is it still liquid?
It's an oil in a capsule.
Okay, so it's probably olive oil based or sesame oil based. So with that, it would just get further down into your gut. And so that's probably why.
Is it okay to do both?
Yeah, oh yeah. You can take big quantities of black cumin. One time I had, I can't remember what I did, but I had injured something really kind of badly. And, for me, I'm like, I don't have time for this. Ugh. And so I was letting the body rest, but I took huge dosages of black cumin, and in a short amount of time, I bounced back like that. And
That reactive arthritis that I had after COVID, when you had me doing the black cumin, then the frankincense, and then the galbanum, man, it cleared up within.
Yeah, black
days.
cumin's really, really good for stuff like that. I mean, it just, in the Quran, it says black cumin will cure everything but death. Pretty much like anything goes according to that writing. And so it stimulates the rest and repair mode. It reduces inflammation. There's some things that it doesn't really work that great for. It's not bad, it's just not great. But anything inflammatory, black cumin always is helpful.
Thank you.
You can put a few drops. The way I used to take things internally was I would put a capsule, I would put 2 or 3 drops of the oil in, and then I had a little squeeze bottle that I would put olive oil in, and I'd close the capsule and take it. You can try doing that if you want to get it further down the digestive tract.
Okay, thank you so much.
Yeah, you're so welcome.
And then I've been taking black cumin complex internally, and it really softens the stool.
Mhm.
So would I need to take less drops of the oil and water?
Is it like too soft or?
Really soft?
Probably reduce the dosage. Yeah.
What's the difference between complex?
So the difference between black seed and black seed complex is black seed complex has
Has anise in it, doesn't it?
no, it has frankincense, myrrh, and turmeric. You're thinking of anise. Yeah. So frankincense, myrrh, turmeric, and black seed. Okay, so hypervigilant response. This is really not so much about allergies, but just regulating the overall immune system. You think everybody has sweet Annie, or a majority of people have sweet Annie? Let's do this. Whatever you use, like if you have sweet Annie, but if not, if you have Anua, if you have mugwort or artemisia, even if you have poplar. Our moist, we are on 13. On page 13, H, right at the top of 13. Sweet Annie, Armoise.
Number one choice is Sweet Annie if they have.
Yeah,
it.
Sweet Annie or Anua. I think only a handful of you guys have the Anua. The Anua is, it's a beautiful scent. It's grown organically. It was handpicked. It's it's an artisanal. artisanal oil. Like it was,
For this particular protocol, poplar is not stronger. or not?
no, it's not stronger. It will work, but it's not stronger. Sweet Annie is actually the A choice. Armoise or Armoise also is right up there. Okay, so with that, go ahead and begin inhaling. Your awareness is on your forehead. Move your awareness to the bottom of the tailbone, the basic chakra. Your hips, the sides of your hips. Your knees, front and back knees. Your awareness is on your knees. You're still on your front and back knees. Your ankles. The soles of your feet. Your armpits. Your elbows. Your wrists. The palms of your hands. Your front heart, the center of your chest. Your back heart. Just be still, be aware. So we're going to do it again. If you're already using Artemisia or mugwort, then just continue. If you are using Sweet Annie and you have mugwort or Artemisia complex, mugwort supreme, any of those, switch. And if you don't, just use what you were using and we'll do it again. So mugwort if you have it, or Artemisia, and if you don't, just continue to use what you've been using. Again, your forehead. The bottom of your tailbone, which is the basic chakra. The hips. The knees, the front and back of the knees. the ankles, soles of your feet. The armpits. Awareness is on your elbows. Move your awareness to the wrists. The palms. The front heart. And your back heart. Just be still. Now, step 3, Palo Santo would be key here. Definitely a high choice. If you don't have Palo Santo, use something cleansing. You can use like a eucalyptus, use frankincense. If you're fancy and you have aloes, you can use aloes.
You said eucalyptus and
Frankincense. The other one is the blue mountain sage, not the other sages, just the blue mountain sage. Very, very cleansing. Another one, if you don't have it, is also could be hyssop. Not an A choice, but works in a pinch. Okay, begin inhaling. Your awareness is on your forehead. Bottom of your tailbone, the basic chakra. Your hips. Your knees, front and back knees. Your ankles. The soles of your feet. Your armpits. Your elbows. Awareness is on your wrists. Move it to the palms. The front heart. The back heart. Just be still. Just be still, be aware, keep your eyes closed. Okay, the last one is going to be one of the chamomiles, a yarrow, milfoil, blue tansy. If you don't have that, spikenard or valerian will work. If you don't have that, vetiver would be another choice. Tansy, any of the chamomiles, milfoil, yarrow,
Alternative.
spikenard, valerian, and then even lower would be vetiver. Okay, ready? Begin inhaling. Your awareness is on the forehead. It's bluish. The bottom of your tailbone, the basic. Your hips. Your knees. Front and back of your knees. Your ankles. The soles of your feet. Your armpits. Your elbows. Your wrists. The palms of your hands. Your front heart. Move your awareness to the back heart, the area between your shoulder blades. Your awareness is on your back heart. Just be still. Notice how you feel. Body feels good, feels relaxed. Yeah. So we're going to let you acclimate to this. We're going to take a 15-minute break. And then we're going to come back. We're going to talk about supplements for a little bit, but I still want to spend a little bit of time diving into some of the emotional components. So let's come back at 10 till, and we'll hit the ground running. Page 15, which is herbs and supplements for allergies. And then let's talk about some of them. Okay, so these are obviously not essential oils, but these are ways to augment the treatment that you're using with essential oils. I just thought I'd write it out for you, and you can have some things to pick and choose from. First off, you hear me talk about it all the time, is quercetin. So again, antihistamine improves the immune response, decreases your reaction to allergens, which is another way to say antihistamine, but the dosage is there. Another one that you don't really think about as being an antihistamine is MSM. It's a type of sulfur. And so a lot of times it's used for arthritic conditions, joints, deposits in joints, detoxifying joints, but it actually is a very strong antihistamine. So you can get it in capsules, you can get it in powder, you can get it in liquid and taken on a daily basis, which is very safe. It has a very strong antihistamine effect. There's an herb from Ayurvedic medicine called Coleus forscoli. Sometimes they call it Coleus, sometimes they call it forscoli. And I think these days, people are starting to use it for weight loss. I don't know how effective it is for weight loss, but for an antihistamine herbally, I'm not talking about like quercetin is not considered an herb, it's considered a supplement. It's crude vitamin C. Same with MSM, but herbally, the strongest herb antihistamine is Coleus forscoli. Again, there's dosages written out for you. Cordyceps is a great way to improve lung function, kidney function, and reduce the production of mucus. Long-term treatment is best. It's not going to be something short-term. Definitely used it for allergy-induced asthma. And again, the dosage is there. So 3,000 milligrams a day is approximately 6 capsules. Smaller dosages, I haven't found to be as effective. And so the other thing that I would say about cordyceps is you need to be sure that it's a good quality cordyceps and not just a cheap cordyceps. And so Post Defense puts out a good cordyceps, but my personal favorite is from a company called Shaman Shack. Best cordyceps that I've found. You definitely can find cheaper, but Shaman Shack, the potency is there. And so a lot of times when you're buying this with mushrooms, when you're buying cheaper, sometimes it takes 3 to 4 times the amount to equal a potent amount of like a really good mushroom. So I would say for cordyceps, don't skimp, get the good mushroom. Nettle, especially good for reducing inflammation in the sinuses. Can be very good for allergic reactions. Garlic is used to enhance the immune response. It has an expelling effect on some of the mucus. Now, one of the things I would say about garlic, if you have an autoimmune issue, don't do it. Like don't use the garlic. It has kind of an antibiotic effect, and it actually will cause achy joints when you use it and you have autoimmune issue. Magnesium is always good, 400 to 500 milligrams. Protects the cells, but it basically keeps the respiratory tract from going into spasm, or reduces the spasm, I should say. Fish oil, again, get a good high quality fish oil, and very good for allergies, especially exercise induced allergic responses. So with all of that, before we jump into the lower emotions, does anybody have any questions?
So I put in the link for Shaman Shack. Someone asked what would be a good site to purchase these supplements. Do you have any others that you recommend specifically?
You just go to Amazon. Yeah. If I don't have like a specialty company that I go to, I just go to Amazon and get it. Part of it for us, we live out in kind of the middle of nowhere. So, Amazon gets it to you in a day or two. You can always go to your health food store, your local health food store, but for us, that's not a big option. So.
How was it?
Okay. So calming the lower emotional responses, you can see that there's a few oils there. They're all kind of fancy in nature. Blue tansy would work well, but acacia and rose also work. And so you can go through and follow the pattern. But let's just jump into some of the oils. First, let's do anger. Anger is one that is very common with allergies, actually, immune dysfunction and allergies. So here, your choices are any chamomile, your blue tansy, cistus, and then either tarragon or mace. So let's make sure that everybody has something, and if they don't, it might not be a lot of choices, but how are we doing? Yeah, mace is, I think a lot of people will have at least the mace or the tarragon. Um, if there's anything we can even do about that. Just have her do the breathing exercise without the oil. It's probably the best bet. Okay, so whatever oil you're using, just notice how your body feels. Notice your emotions, your mind. Begin inhaling. Your awareness is on your front solar plexus. Move to your back solar plexus. Your spleen on the left-hand side, just below the ribs. Your awareness is on the spleen on the left-hand side below the ribs. your navel. Bottom of your tailbone, your basic chakra. Awareness is on your navel. Move your awareness to the basic chakra, the bottom of the tailbone. The soles of your feet. Just be still, be aware, keep your eyes closed. Let's do that one again. So begin inhaling. Your awareness is on the front solar plexus. Your back solar plexus. your spleen. Your navel. The bottom of the tailbone, the basic chakra. Soles of your feet. Notice what you feel. Just let everything go. Keep your eyes closed. Notice what's happening in your body. Notice your emotions, your mind, your body. Let's share experiences just on this emotional component. Let's keep it to this. Later we'll answer anything, but right now let's keep it to this particular topic.
And you can unmute yourself.
Yeah, unmute or type in. Let's just share our experiences.
I'm feeling real warm and fuzzy, kind of like I got a smile from the inside out. Very
Very
comfortable.
good. Yeah, very
Thank you
good.
very much. It's good stuff.
Good. So, Peggy, did you feel like a tension leave, or you feel just lighthearted? Like, what do you notice?
I just feel calm all over, like a
Okay.
supportive sense of well-being.
Right.
I didn't really notice anything leaving, but
No.
I just
Okay, so she brings up a good point. She doesn't feel anything leaving because this isn't like psychological healing where you're feeling like an issue leave or a trauma leave. You're simply calming down triggers and like agitations. Like if you don't have agitation here, you would just go, oh, this feels relaxing. But if it was really agitated, you'd feel like, oh, I feel calmer, I feel less angry. But it's not about any sort of content. You know, it's not about an issue leaving. You're just calming down triggers. You know, you're just you're calming down the mechanisms that generate these kinds of emotions. So you said it perfectly. So
Thank you.
somebody else? Yeah, good. Somebody else want to share?
Yeah, we had some people type in. Lower energies be damned. So the early,
Yeah, I could feel.
so the earlier physical fidgety and restlessness has been tamed.
Good. Yeah. There's actually one of them in here is actually restlessness. You know how like sometimes you just, like you said, you get fidgety and you just, feels like you just can't calm down. That is still actually one of these responses.
I feel energy shifting and my body is not liking it.
Like in what way? What's it not like?
It actually got restless.
Yeah, well, maybe let's just go down to the restlessness one. Keep sharing your feelings and I'll find restlessness.
Someone right before you did that said, give me that restlessness protocol. So that's funny.
Ah, God, it's fancy things. Ooh. Okay, other people?
Monkey mind calmed and body wants to sleep. Another, I feel buzzy and good. Someone said, lots of gratitude towards you, peace and calmness.
Good.
I feel calm and relaxed. All the challenges I've been facing came up. I felt like I was watching it like a movie without being upset about it. This is one of my allergy triggers. Ease. Like anger. Is
Anger,
one of the
yeah.
allergies.
Yeah, I would say that the allergies were probably already there and the anger is getting triggered. They go hand in hand a little bit. But here's the bizarre thing. If you're like, say you're in a job and your boss is always getting angry at you, it can intensify your allergic responses.
Repeat that.
Like say you're at a job, you're not angry, you're not upset about anything, but you're dealing with somebody who's always angry. You say you have a boss who's always angry, for example, and they're venting on you, they're angry at you. Over a period of time, like a few weeks to a month, it actually will start to exaggerate your allergic responses.
Very fluid, almost Stretch Armstrong sort of loose.
Good. Yeah, I'm looking up the restlessness protocol. It's fancy oils. Hardly anybody's going to have them. It's Embret and Narcissus.
It narrows it down to probably.
Yeah, let's keep it to.
But some more shares.
Yeah, let's do some more shares.
I saw the red color as explosions leaving me. Mind is very calm. Oh, and they wanted to clarify when they get angry, it intensifies all their allergies.
Yeah, I would agree with that. Yeah.
Someone goes, I have fancy oils. I guess I'm not ombre or narcissus fancy.
Those are not only fancy, but they're also quite rare. So, I mean, restlessness, it was hard to find things that worked really well for that. Yeah, anyway.
Jenny, did you have something you'd like to share?
Hi, Greg.
Hey.
Are there any other uses for Ambret or Narcissus besides restlessness?
Oh yeah. I'd have to go back through and look at my notes. Both are super activating to the heart in slightly different ways. Ambret, I actually used to treat depression. Narcissus. I use it for esoteric applications. I'd have to go through and look at my notes. Like, I mean, I use them, but I don't use them like tons. So, Embred is one of the best things. Is rose and Embred are really good for depression. You know what else is really good for depression is lemon verbena. Especially depression with like deep-seated grief. Lemon verbena will help release the grief. I'm thinking we might do a class just on depression at some point.
Or restlessness.
Restlessness, yeah. I'll see if I can come up with a different oil, like before the end of the day, so we can do that protocol, because that's not fair. Ambret and narcissus, really, those are the two oils for us, restlessness.
This is a good share though. Someone interrupted me and gave me news that was very disappointing. When I got back to here, you were starting the second round. It calmed everything down.
Yeah. So, I mean, that's a perfect example is like, you can be in the middle of being angry or upset and sit down and do this protocol, and, you know, it will suck the anger like right out of you. I mean, because it's not about the content, it's just about the response. And so what happens over a period of time is you can have an issue, you just don't have the anger response, or the anger will come up and pass really super quickly. And so that's the goal. It's not that anger doesn't happen, it's just that you don't get hooked into it and it doesn't last for a very long time. Remember, somebody asked the Dalai Lama if he gets angry, and he goes, oh yeah, but it passes in a minute or two. And so, you know, it is part of our biology, but at the same time, we don't want it to be just a state that we're in. I mean, I think we've all known somebody who is just, no matter what's going on, they're angry. That is tied to their immune system, actually. Over a long period of time, that will manifest as a serious health issue.
Can we give this to somebody who's angry all the time, but tell them it's for cold and flus?
God bless you, and yes. I do that all the time to my family. Colds and flus are stress. Yeah. You know, because that's also kind of true as well. And so here's my feeling on that is sometimes you have to give the right amount of information to people at the right time. And sometimes if you give too much information, they'll discount what's happening or what you're doing because they don't agree with the information. So sometimes less information is better, and just get them to have the experience, get them to go through and do the process. Okay, so let's do, this is one that probably a lot of people have the oil for. So we'll see how this feels, but it's G, despair. So it's at the top of page 19. And the oils are Palo Santo, Petitgrain, if you have either one of those, but also rose or strawberry flower. Strawberry flower is not from strawberries.
Yes, any rose.
Yeah. Okay, are we good? Think so? Okay, so again, this is just responses. It's not necessarily about content. So let's just see how this feels. Begin inhaling. Your awareness is on the heart. go to the outsides of the shoulders, the outside of the chest, the shoulder minors. The back heart, the area between the shoulder blades. Awareness is on the back heart. Your awareness is on your navel. An inch and a half below your navel. The crown. The top of your head. Just be still, be aware. Again, just be still and let go. Again, the same oil, same application. Your awareness is on the heart. The shoulder minors, the outer part of the chest where the chest and arm meets. The back heart, the area between the shoulder blades. Your navel. An inch and a half below your navel. The crown. Just be still, be aware. Just be still. Notice how you feel. Notice your emotions, your mind, your body. Think of this as a kind of untangling of sorts. Okay, we're going to do one more before we start taking some questions. So go to the top of page 24. We're going to try to tackle the restlessness without embret or narcissus. And so let's go back to what we used before. Spikenard, valerian. If you have lavender or vetiver, like one of those choices. Okay. So ready? Begin inhaling. Your awareness is on your heart. Move your awareness to the top of your head, the crown. Go to your solar plexus, below the ribs. Do the front and back just to make it more potent. Front solar plexus and then also mid-back at the same time. Awareness is on the throat. your back head. The area between your eyebrows. And the bottom of your tailbone. Just be still, be aware, keep your eyes closed, just be still. One more time. Your awareness is on your heart. Your crown, the top of your head. Your solar, your front solar and your back solar at the same time. Let's make it a little bit more potent. So front and back at the same time. Your throat. Your back head, opposite your eyebrows on the back side. Between the eyebrows, the ajna. The bottom of the tailbone, the basic. Just be still, be aware. How do you feel? How does your body feel? How's your emotions, your mind? You can unmute or type in. The people who are having restlessness issues, how did that treat you?
Peggy Bumble?
Hi. Well,
Hey.
I'm kind of stuck to the sofa now. Can't quite move or get up.
Yeah, that's perfect.
Just totally relaxed. Could this work for ADD?
There would be more things that we would do for ADD. You know, ADD is you're having the opposite response. So like you use stimulants to calm things down, and things that are calming are stimulating. And so like what we just did would actually probably, because of like, especially with the spikenard and the valerian, would actually probably make them more stimulated. And so I think we're looking at doing a series of these free classes, and ADD was actually on the list of one of the classes that I'm going to do.
That's great.
So,
well,
yeah, because there's actually 8 different kinds of ADD and ADHD, and you know, some of them take slightly different treatments.
Okay, well, I'm calm and relaxed, so I think
Yeah.
we did.
So like with ADD, like for example, like if you give them cinnamon, like most people would be kind of stimulated, it would calm them down.
Wow.
Yeah, it's a they have a paradoxical response to the substance. Like one time I gave somebody valerian, and I wouldn't even call her ADD. She just she was extremely fatigued, and we were trying to get her to get a good night's sleep. And so we gave her just a little tiny bit of valerian, and she said it was like drinking 5 espressos.
Wow.
You know, so it's like had we known that she would have had that response, if we would have given her cinnamon, it would have knocked her out.
It's just when I think of the word restless, it just ADD came to mind. That was why I asked.
Yeah.
That was just my language, brain going,
Yeah. Well, it is like kind of a restlessness, but there is a bit of exhaustion tied to that condition, and some parts of the nervous system got overstimulated. So the goal would be able to treat that so that that stops happening.
Okay, thank you.
You're so welcome.
We had some shares. Missed several places, zoned out.
Yeah,
definitely
good for you.
not
Hey,
restless.
great problem to have. Super great problem to have.
Knocked out. Time for a nap.
Yeah. What a great way to spend a nice little quiet weekend.
Super relaxed and sleepy. I almost fell from the chair. During despair, sadness arose. It increased 20-fold during restlessness, crying me a river, only it's not for me.
Yeah, and sometimes a good cry and it's gone. You know, it's just something that was trapped in the body.
What was the condition for the last protocol? That was what we just did. Was
Restlessness.
Right? Okay. Very relaxed. All right, great job, guys.
Okay, so we'll do Q&A and everything. And so if you start floating away now, I want to say something really super important. Happy Mother's Day to all the mothers. And, you know, I hope you have a special day tomorrow, and you know, you'll be in our prayers and blessings. Tomorrow's Sunday service with a star. We're going to be doing just prayers and blessings for mothers. So, and remember also at the end of the month, the 29th and 30th is a free, like kind of spa retreat weekend, you know, half retreat, half spa. So, you know, be sure to join us there at the end of the month. So let's take whatever questions come our way now.
Perfect. Go ahead, Balaji.
Hey, Balaji.
Good evening, Greg.
Hey, how are you?
Good. So one quick question regarding, again, we went through the respiratory piece and all. So, because you've read the news in India, right?
Yeah,
so the
yeah,
COVID
got it.
virus, so it's
Gotta
affecting
be.
the lungs. Sorry, yeah. So that like people have breathing issues. They have low oxygen levels in the blood.
Yeah.
As a matter of fact, I lost 2 friends to COVID last week. It is, I don't know, I'm just...
Oh, God, I'm so sorry to hear that.
Yeah, it's like been crazy, but yeah. And again, I'm hearing news all over in the sense like... anyway, so I was wondering if there's anything you can recommend that I can share with friends back in India, like which...
So like as far as oils, or what are we talking?
Yeah, like oils, like maybe hopefully, I don't know, something I can help out, because anything I can... Because I'm praying, I'm blessing and all.
Yeah.
Something physical I can...
Yeah.
I don't know.
It's a difficult situation. So the ones that I've used for that here has been hyssop decumbens and helichrysum. Now, one thing that they might have access to over there is possibly they might have access to Ami Visnaga, but there's this other herb that they might actually have access to called asafoetida.
Oh, asafoetida. Okay.
Yeah, have them take asafoetida. I have an essential oil of it. It smells, it is strong.
Yeah. Because we use asafoetida every day in like cooking. So yeah.
So have them take a decent sized dosage of asafoetida. It's really good for the lungs. It's really good for the lungs.
Okay. And basically take it like in powder form, like mix it in water or something.
Yeah, like mix it in water, like the equivalent of like 2 or 3 capsules.
Okay, so and then another follow-up question I had. Again, we talked about like these lower emotions. We went through a series of I guess protocols, right? So because again, we've had several classes around higher emotions, oneness, and so on, right? So I was wondering if there's like one or more oneness with the higher soul or consciousness protocols that can like sort of take care of all these lower emotions. Because again, from my understanding, again, as the higher soul comes in, you have a higher soul, like soul contact, if you will.
Yeah, this is actually more of dealing with the roots in the body. And so a lot of times when there's increased soul contact, these get more agitated. So there's the part that you're talking about is bringing in, but at some point you have to go in and wrestle with the nature of the body itself. And so this makes it so that more soul energy could come in. At some point it does reach a tipping point, but for a little while you just gotta tweak it. You know, not everybody has all the issues, but like if you just feel like God, I have the tendency to have melancholy, or I get angry, or you know, I feel lonely all the time. Even people can feel lonely and be surrounded by people. You know what I mean? Like it's not necessarily proximity to people. They can still feel quite lonely. And so some of this is just actually a physiological response in the body. So you don't have to go through and do all of them, but you know, a couple of them will resonate for several people. Like a couple of people were like, the restlessness thing, I got it. You know, or you know, just sadness or you know, something of that nature, melancholy. Boy, you know, that kind of sounds like me. You can go through and treat several of them, and you don't have to do the whole gamut.
Okay. And one final question for the evening. So what are those cool rings you're wearing?
Cool. This is one that's a heptagon. It's like the seven points, kind of like the star symbol, but an old version of it, an ancient version of it. So it helps bring in the energy of the 7 classic planets. And then this one on this hand is the seal of Solomon. Oh,
okay. So can you get those at Astara?
If you want, I could probably run them down for you. Yeah.
Oh, great. Okay, thank you.
Yeah, if you want them, they shouldn't be very expensive.
Okay, so I'll reach out and like through an email or something.
Yeah, let us know through an email, and I'll go through and find the vendor, and I'll just hook you up with the vendor.
Okay, great. Thank you.
What's the difference between the hypervigilant immune response protocol and what we did first thing today?
The first thing today is very specific to allergies. The thing that had to do with the hypervigilant immune response was just a general immune response.
Go ahead, Barbara.
Greg, would you differentiate a little bit between annoyance and agitation?
Yeah, agitated could be
is one more emotional, one more physical, or are they not quite?
Like annoyance tends to be more about people, and agitation can be more about just the environment. You know, like sometimes you're just in the environment and you just can't feel comfortable or safe or like, you know, just everything in the room, like nothing's quite matching. Agitation can be just a state where annoyance is usually people.
Okay,
You know what I mean? Like it's that one's purely people.
got it. Thanks.
Yeah. Does that make sense? Like you could go into a place and it's like the color of this room is just agitating. It's not really annoying. It's just, it doesn't feel good. And sometimes it's not because you're in that state. It's sometimes you're in a place that is agitating in nature. Like, you know, it might be really like chaotic, or you might be in a place where there's lots of people talking over each other. Very agitating. Then there's times where annoyance is just usually when you're dealing with a person. Like I knew this person, like he's literally a genius. And so I laugh because it's happened a couple of times to me. You can tell when he's talking, he's starting to get annoyed with you because you're not keeping up. But it's like on the flip side of it, we're all not geniuses. Like this guy's a genius and we're not. And so when he talks, it's hard to keep up with him, and you know, he gets annoyed really super easy. But part of it is he's also super intelligent.
Yeah.
Yeah. Doesn't mean that the annoyance is okay. It's just it's one of those things where sometimes I feel kind of bad for it because it's like he gets annoyed by everybody, but at the same time, I think he feels quite alone.
And one other question, working these lower emotions, is it always personal, or are you ever tapping into something broader than your own?
Well, it's more about just like potentials that your body has. And so it could be that you generated the emotion, or it could be that something external generated the emotion. That could be a situation, an environment, or a person. You know, like a person comes in and you're totally fine and peaceful, and they're angry at everything around you. They're angry at other people. They're a little bit angry at you, and then they walk away. All of a sudden you might start feeling anger. It's really not been triggered by you. It got triggered, but it wasn't really you. So it's not really about content. It's more just something got agitated and triggered. So it's not content driven at all. So
Okay.
it could be you, it could be other people, it could be an environment, it could be, you know, it could be the collective unconscious, you know, it could be that a group of people in your environment are feeling a particular way, and you might not even be interacting with them, but it might be impacting you. Yeah, it could be any of that.
Is it resonating with something your body's holding? Like, is it past?
No, it's just it's more of just a reaction. Like your body, and once it gets agitated, it can stay in that state. But it's you know, if you have some traumas or things that are locked in the body, they might be agitating as well. But it's not necessarily about what's holding in your body. It's a lot of times it's reactions to things in the environment.
So it's not time bound, past, present,
No,
future.
no.
Okay.
It's just either you're agitated. It's like either the light switch is on or the light switch is off. How long ago doesn't matter, and where it came from doesn't matter. It's just either the light switch is on or it's off.
Okay, that's
Yeah.
helpful. Thank you so
Yeah.
much.
You're so welcome.
Peggy, your hand's raised?
Yes, thank you.
Hey, Miss Peggy.
You know, I since I take so many classes, I forget where I got the information, but it wasn't in Wednesdays and it wasn't in Sundays. So I'm thinking it must be Tuesday night. You did an invocation where we Our Father and went to the different chakras. You also used a different, like there was a subsequent equivalent or close to Our Father, or Thy will be done. There was another phrase, or I thought it was a separate meaning, and I was going to say
it was the Peggy. It was the minister meeting.
I'm so sorry. That
No,
was
that's
Thursday.
okay.
No wonder. I could still look it up. You don't have to tell me, but I thought
it's
maybe
okay.
it was from. Go ahead.
Say what you're going to say though.
Well, I was just going to say, well, maybe it was from some of like the Kabbalah or Solomon's teachings or Scott Peck did one where he took Our Father and gave it separate, very similar kinds of thoughts and words. And so I didn't know where you got it. And I thought, well, if you tell me, I'll go look it up. But now that I know where you did it, I can listen to it and write it out.
It's old Kabbalistic writings. Yeah.
Okay, so I can't go look it up.
I'll find the source. It was so long ago. I'll have to go look it up.
Letty's putting something up about Our Father. So
well, there's the Our Father, but it's also tied to the things that Elohim said.
Yes, what I will do is go back and listen to it. Now that I know where I can find it, I will listen to it with my pen and paper in hand. So thank you.
And pretty soon, Astara might have a book that references that.
Well, I look forward to it. Okay. Thanks a lot. Great class. And you know, when you wish the mothers happy day, I say happy day to everybody because somebody had a mother, or they may not be a mother, but so anyhow, a happy Mother's Day to you and Samantha and your team. It was another great class and I'm honored to be here. Thank you very much.
And Danelle, your hand's raised?
Hey, Danelle.
Hello, sorry I had to unmute.
Okay.
Yeah, Greg, I just wanted to mention, I do energy healing and hypnosis with people,
nice.
and I've been utilizing a lot of these different protocols like prior to doing the hypnosis and healing.
Oh, tremendous. How's that working?
And it's just been super effective. I'm just really appreciative. My clients just love it.
What kind of energy healing are you doing?
It's sort of a combination of, Reiki, kind of hands-on healing.
Nice.
Some stuff that I've learned from you, some pranic healing. So it's just a combo of different stuff. I just sort of listen to my guides and let it flow.
and it's helping with the hypnosis as well?
It is. Yeah, it is.
Good.
Especially with my pain relief clients and those that have PTSD. Yeah, it's awesome.
I bet. Yeah. Good for you.
And I had just a couple of quick questions. I know you had done like that, I think it was a 3 or 4 part protocol earlier this afternoon. And I was just wondering if that can be used because I have really chronic sinus like infections and issues. I was wondering if that could be used for that.
Yeah, like let me go back and look at what we're looking at.
They are due to allergies too.
It is due to allergies.
Mm-hmm. Yep.
I would do. So we're going to post a pattern. Okay. And so under the part under asthma, even though this isn't asthma, you're dealing with sinuses. Yeah. Let's post a pattern in the sinus pattern. We're going to post a pattern for you. And
is it the sinus pattern? Because I'm familiar with that one.
Yeah. Oh, okay, so cool. Sinus pattern. And so I'm going to have you do 4 segments. You see inflammation, tension, mucus, and then emotion. The emotion that you're going to treat for that is going to be actually stress. Like a lot of times with chronic sinus issues, there's a lot of stress energy that gets generated and stuck in the nasal passages.
That makes sense.
One of the main conditions that I treat in the corporate setting is sinus congestion, like sinus infections. And so, like high blood pressure, migraine, sinus infection, they're all byproducts of like just high levels of stress, in that setting. And so let's have you like reduce inflammation, break down the mucus, like go through and do all that. So with the first segment, let's have you do something that's actually not there. So let's have you write this down.
Okay, I am.
Let's have you use rosemary verbena. If you don't have that, just use regular rosemary, but rosemary verbena if you have it. And then number 2, anise if you have it, or aniseed myrtle.
Yeah, I don't have that.
Do you have Amivisnog as a stretch? Do you happen to have that?
No.
If not,
but
okay, what about galbanum?
yeah, that one I have.
Okay, let's have you use galbanum.
Okay.
And then 3, let's have you use, do you have terebinth?
No.
How about hyssop?
Yep.
Okay, let's have you use hyssop. You could also use bay laurel there if you have that.
Oh yeah, I have that too. Okay.
Let's have you do bay laurel.
Bay laurel instead. Okay.
Yeah, yeah. And then the last one, emotions. Do you have marjoram?
Yep.
Do marjoram last.
Okay.
All of them with the sinus pattern. With the last one, you could rotate marjoram with, sometimes use marjoram, sometimes use spikenard.
Okay.
Yeah.
And that all these are with the sinus pattern.
Yeah, just do one right after the other, like fire through all 4 of them.
Oh,
Yeah.
okay, cool.
If you kind of do that on a regular basis, like sometimes with like the rosemary, you could rotate and do basil instead. But for a while, let's have you use rosemary.
Okay.
Just because rosemary is very good about moving blood to the head and getting blood to the mucous membranes.
Okay.
And it still has some antispasmodic properties to it. Eventually you could graduate to basil, but let's have you follow the ones that we said. And maybe after about 10 days of treatment, let us know how you're doing and we can adjust, but that should significantly reduce your congestion. You could also take a little bit of something that's an antihistamine. If you have blue tansy, you could use that. If not,
I have blue tansy in a blend.
oh, yeah. Take a little bit of that internally. Yeah.
Oh, okay.
Yeah. As long as, like, what blend is it?
Well, it's from doTERRA. It's called Balance.
What else is in the balance?
I can look it up.
Yeah, look it up and email it to me. I just want to make sure that it's okay to
Okay.
take internal. But
Okay.
yeah, that might work.
And then my other question is about the emotion that you covered on anger. Can those be taken internally with the same effect, or is it better to inhale it?
They might work internally. Probably better to inhale, but like the one for anger, for example, let me look that up. If you were going to try to calm anger down by taking it internal, one of the chamomiles or the tarragon.
Okay.
Those are your best bets.
Okay,
One of the ones
good.
that I use sometimes, like if there's a little bit of anger and it's just bubbling, is rub the tarragon on the bottom of the feet. And a lot of times it will take out the claws, like
Yeah.
the anger claws. Yeah.
Okay. Well, thank you very much. I've
You're so
enjoyed the
welcome.
classes.
Hope you enjoy it. Yeah.
Thank you.
You're so.
All right, I'm gonna go to some of your questions from earlier, guys. Feel free to raise your hand and we'll keep taking questions, just so you know. Constipation also linked to malfunctioning of the diaphragm, because you were talking, this is way early in the morning, about I think it was diarrhea being tight diaphragm. Could constipation also? I think it's what that question is from.
I would say not necessarily tension in the diaphragm. I would say tension in the smooth muscle could actually very much cause constipation. And so things like anise or galbanum, tarragon could be helpful to reduce some of the tension in the gut. I would also say that make sure you're taking enough fluid, and sometimes you can add things like flax oil or something like that. I mean, constipation could be several things. It could also be the movement, the rhythm in the digestive tract could be off. That could be enhanced with cinnamon. It also, like, it could be poor innervation from the nerves. So again, the anise would really help with that. Yuzu is another one, but I doubt a lot of you have yuzu. Anise is probably something that some of you have. So I would try that first. You could apply it topically, but I would still take a couple drops in water internally if it agrees with you.
Best oil for salt bath tonight?
Best oil for salt bath. Well, if we want to stay in the vein of allergies, I would say maybe do a salt bath with like sweet Annie or Nua, mugwort, blue tansy if you want to be fancy. Wormwood if you have it. If you don't have that, why don't you do something like chopper root cleanser or Palo Santo?
Go ahead, Tracy.
Hey, Miss Tracy.
Hola, I'm getting ready for my trip.
For your what?
I'm getting ready for my trip.
Oh.
I just wanted to say thank you and how much I appreciate how much
you're so sweet.
you supported me through all this crazy family stuff.
Yeah, you're so sweet. Yeah. Hey, we're all there for each other, you know?
Yep.
Everybody goes through it at some point.
Yeah, it has not been easy.
No, you had a rough version of it, that's for sure.
Yeah. So hopefully it will ease up. Still
Yeah.
probably 6 months away because of everything, you know.
Yeah.
But I appreciate it, and
I hope everything calms down for you and the family.
Thank you, and I feel a lot better. Like just
good. I bet.
Yeah. I
Yeah,
appreciate
you're out of the hornet's nest.
Yes. And I think they see the wisdom of just letting things go the way that they're going to go.
Yeah.
So
you would hope, but
well,
you never know.
The squeaky wheels get everything anyway in the end.
Yeah,
So
yeah.
It's in their best interest to just shut up. But thank you very much, and I hope you
You're
guys
so welcome.
have a wonderful weekend.
Thank you.
Can one take Moroccan thyme internally?
Yes, it's best to actually take it internally. Yeah, a couple drops, really good for resetting the thymus. Also good for low-grade infection that's been chronic.
One of the off-topic, my friend has lots of pain in the calf area of leg for many years. Any suggestions? But we need more specifics.
Yeah, so because the issue there is there could be just a calf issue, but because it's in the calf, it could also be cardiovascular in nature. Just to reduce tension in the calf, you can use something like marjoram, basil, petitgrain, spikenard, valerian. Milfoil is a really nice one just because it is anti-inflammatory and takes out the tension. But the concern would be that there's potentially a cardiovascular issue. And we'd want to see if there was high blood pressure or if there was, any other sort of cardiac issue, because that is one of the signs. Is like if they were in the hospital and they were presenting with any potential cardiac issue, one of the first questions they ask is, do you have pain and tension in your calves? And so I'm not saying that that's what's happening, but it's one of those things where,
They said no issue with that.
when's the last time they've had their blood pressure taken?
Not on any medication.
But that doesn't mean just because they're not on medication, like it would be like, when's the last time they've had their blood pressure taken? Yeah, do we know?
It says last year.
How long has the calf thing been there?
Many years.
Yeah, I'd still feel more comfortable if they took their blood pressure. And what's their cholesterol, do we know?
No.
So the pain is presenting as like a cramp, or is it like a sharp pain, like a dull, achy tooth pain?
It's constant, but what type of pain? They don't know.
Yeah, we would need a little bit more information. I mean, it could be sciatic pain coming down from the low back and the hip, and it's manifesting there.
Not shooting pain.
Yeah. I mean, without having more details, I would treat it like a cramp. I mean, it could be that it's neurological in nature, but treat it like a cramp, and so marjoram, basil, petitgrain, things like that, and then do some lymphatic work on the area, and maybe get some more information and let us know, and we can try to troubleshoot that a little bit better.
I have a client that's having a hard time getting rid of a wart. What's the best thing for that?
So warts, you can do a couple of different oils. Like one of the best oils for warts is thuja, and she would need to put it, or whoever would need to put it on daily. And the wart kind of starts to break down, and you can kind of scrub it like with a washcloth and keep wearing it down. Other oils that work, actually, tea tree will work, and actually lemon will work, but thuja works the fastest, and thuja is the best for really eradicating that virus that's in there. And it will take a little while. It'll take a few weeks sometimes, but yeah, just daily application of thuja on the site.
And Cindy, your hand's raised.
Hey, Cindy.
Hi, thanks for everything. Stop me if this has already been talked about, because I had a graduation, I missed a part of the class. So the question is about a reaction to medication that was more like really high anxiety and almost like a panic attack. Would that be could I use the acute anxiety protocol? Would it be an allergic reaction, or is it is something totally unrelated?
So they had like really bad anxiety. They had a panic attack from ingesting the medication.
Correct. It was Rumidex to lower the estrogen post to cancer, and so her concern is because she's now not going to be able to take it, and then that increases her chances of it coming back.
Yeah. So okay. So a couple of things there. That she had a reaction. So there's an herb that can it doesn't work like the medication. I mean, it's not going to be anywhere near the potency of the medication, but there is an herb, and it's also an oil, but you can also just find it herbally, is Damiana. And Damiana gets used a little bit to do exactly what you're talking about for estrogen-based tumors. I mean, it's not going to completely fix it, but it will help. You know.
Okay.
And so for that, that can be helpful. The anxiety attack.
Well, she doesn't have it anymore. They took her off it.
Okay.
The medication.
Honestly, I would probably do something like have her inhale like Sitka or hyssop decumbens. I mean, regular hyssop would work, but Sitka or a hyssop decumbens would be my first two choices, because it looks like it's having an impact on her breathing. And you know, the thing is the endocrine system, the nervous system, and the immune system kind of function as one big system. And so when you start kind of manipulating one, they'll all kind of respond sometimes. And it looks like her breathing just gets thrown off, and then she starts to have the anxiety or panic attack. You know, it's not emotional in nature. It's actually she's having a physiological response. You know, produces an emotional response eventually, but the initial, you know, reaction is actually respiratory.
Oh, interesting. Yes, it was very physical, you know, crawling out of your skin.
Yeah. She looked like she got really agitated when she took that med.
Oh, she was in bed for 2 days with it. Is there a resource where I could look up contraindications on this because of
the Damiana? I have a book I can go through. I don't know that it's even in the book. It's not a really super well used thing. I'll see if I can find information on it, but you might just have to go like to WebMD or something.
Okay. Yeah. Okay, thank you.
Okay, I'll look as well.
So the question wasn't an allergic response, or was it?
No, it probably was, but like an allergic response sometimes when you're shifting the body around, especially when you're dealing with the hormones, can still be like the immune system and the nervous system kind of playing almost off each other. And so, you know, an allergic response can make your breath shallow, go rapid, you become diaphoretic. You know, the diaphoretic response is actually your autonomic nervous system. You know, like you break out into a sweat. And I mean, in extreme cases, I've seen people even have seizures and things like that. All of it can still be part of the allergic response or allergic crisis.
All right, thanks so much.
You're so welcome.
See you next week.
Keep me posted on that one. Let's keep her comfortable and see if the Damiana helps.
Okay, well, you'll be here next week, Al.
Oh yeah, that's true.
Thanks.
Yeah.
Thanks.
Go ahead, Narayani.
Oh, hi. Yes, sorry. While we were on that topic of sort of reactions to medications, I have a question. I asked earlier and I had to step out for a couple of hours. I don't know if it got answered, but and it may be a little premature talking about this subject, and I know it's a bit controversial, but in regards to people having reactions to the COVID jabs that are going around right now, I've heard and done some research and found a lot of the pines, the firs, the spruces, the things like that are being recommended either as brewed whole herb or essential oils to help sort of balance some of the, and it's being spoken of as maybe allergic reactions, but it seems that we're talking about allergies. I don't know if things to like reactions to medications like that.
Yeah. So yeah. A lot of what people are having are allergic reactions to the vaccine, and so what we've had them use is a couple drops of lemongrass internally in water. That usually helps substantially, and then also you could use like black spruce or the Sylvester pine on the wrist. And then sometimes the lymph nodes in the area of the shot get swollen. And with that, Bayloral, like on a compress or a whole bunch put in soap and then rubbed over the area and then washed off, can be very beneficial, you know, like in the armpit and all that. And so you want to keep the lymph nodes as cleaned up as possible. So,
Okay.
Yeah.
Right.
And Randy, that was actually the next question that was going to be asked. So good timing.
Good time.
Is there an oil good for skin cancer prevention?
Skin cancer prevention. Does the person already have some bouts of skin cancer or anything like that? You're just trying to prevent.
Yes. They are yes, bouts, I think is one they said yes.
I probably would do some form of either in a bath or in topical application like lotion or like alcohol, so a liniment, either yarrow or milfoil. Now, if there's sites where there is like pre-cancerous things, orange oil, like you'd put it on a Q-tip and then apply it to the spots, can be very, very helpful. I've even had situations where that's actually cured the condition, but it doesn't happen every time. And so orange oil can be helpful. And the great thing with orange oil, it's cheap. And it is a little bit sensitizing to the hands, especially areas that are sensitive to begin with. So like soak the end of a Q-tip and then rub it all over the spot so you don't get it all over your hand.
Is there a pattern or protocol that can address yeast infections? Actually, that person's gone, so I don't know.
German chamomile, I'd probably take it internally. I don't know that a pattern will work, but probably take it internally.
And sage baths for hot flashes, question mark?
Yeah, you could do sage bath. You could do on the wrist. You could do a liniment or massage oil, but good size dosages of sage is helpful for hot flashes. Also, you would want to use, you know, especially the night sweats, but if you use Vitex, like 1 to 2 drops, like put on your wrist or in the temples daily, hot flashes usually diminish quite substantially.
And then can mandarin or tangerine be used instead of orange?
No, it needs to be orange oil. Yeah, they all have somewhat different chemistry, so it needs to be actually just the good old fashioned orange oil.
And they did try Vitex, but it didn't really make an impact.
How long did you use Vitex?
For months.
Yeah. You can try there's a oil called Bible leaf. You could try that. Vitex usually nails it. So when you can increase that dosage, a couple of drops is pretty potent. You could increase the dosage. You could try Bible leaf. You could also augment with, there's an herb that you get at the health food store called shatavari. Shatavari, Shatavari. That's one to try, and then also black cohosh.
They love the shatavari. I'll get that. She says.
Yeah, shatavari is. A lot of times I have them augment the Vitex with the shatavari, but you know, you can just try shatavari by itself.
And Jeff, your hand's raised.
Hey, Jeff.
Hey, Greg.
Hey.
Thank you, Greg and Samantha, for this great class
My pleasure.
and for all your help this last week.
Yeah, my pleasure. You feel better?
I've been teaching online the last year as a school teacher, and I've been sitting at the computer 8 to 10 hours a day.
Oh man.
Doing all the online Zooming and then all the lesson planning, and everything has revolved around the computer. And I've just been having some really tense back, neck. It's hard to hold when I put my hands in the position to work on the keyboard. I'm feeling it between the shoulder blades and up here on the trapezius area. I'm doing a lot of marjoram.
Okay. Is that helping at all or no?
It does help. I just can't, I've been doing some of the unwinding protocols for the neck and the back, and I just can't seem to.
You know what I would do is I would actually probably, keep doing that, but let's have you do some work for just good old fashioned stress. And everybody is displaced. Some of the stress that I think you're feeling is also the people that you're dealing with, not just your stress. And, everybody's been really super displaced. And so let me send you a specific stress protocol that we can just like write up just kind of for you.
Oh, great. Thank you.
Even try like just taking long, slow, deep breaths with the marjoram, not even following a pattern, just let the marjoram kind of, inhale it, and it reduces the stress, it tones up the vagus nerve, and it pulls the body out of that stress state. And so it's not going to be the complete thing, but it's definitely a move in the right direction. So marjoram on the back is good, but just do long, slow, deep breaths. If you want to put your attention a little bit on the lungs or a little bit on your gut while you're doing it, even better.
All right, thank you.
Yeah. My guess is it's just that it's like a lot of times when you have tension like that and starting to feel like locked up, it's like physicalized, it's like physical stress.
That's what it feels like.
Yeah, I bet you almost
it has
99%. That's what it is.
It has been very stressful for me and the students and for their.
I bet.
So yeah, I resonate with what you said. Thank you.
You're so welcome. Yeah, keep us posted, Jeff. We're gonna send you a little thing to do out of one of the booklets.
Oh, thank you so much.
You're so welcome.
Is there anything to help gastroparesis issue with food taking too long to empty the stomach causes nausea, vomiting?
Oh boy, nothing off the top of my head. Off the top of my head, the very first thing I would try is probably cinnamon, to be honest with you. Cinnamon and water, cinnamon or cassia.
Is reishi as good as cordyceps or?
No, they do.
Ganoderma?
Yeah, they do different things. Ganoderma and reishi, no, it needs to be cordyceps.
Is there anything that would help with nausea possibly caused by one of many prescriptions? My dad has spent the past couple of days bedridden, and it has happened more than a few times now.
Okay, so right off the bat, make sure he's drinking enough water, like right off the bat. It could be a little bit of dehydration. After that, kind of the first go-to ones for nausea would be ginger and or peppermint. If those don't work, then you start looking at things like cardamom. If it's a lot of medications and those aren't working, you know what an old school remedy is too, is having him drink a Coke, like cola, like have him drink a cola. Sometimes that will actually knock it out. In the old days, there used to be a thing called cola syrup that you could take for nausea. And I mean, you have to take a lot of it, but I know Master Choa, sometimes when people had weird bouts of like nausea or upset stomach, he would have them drink a Coke. And sometimes it makes it go away.
And just to kind of follow up, we do believe this is a side effect of a medication he started in an attempt to slow down the possibility of an ALS diagnosis. So. Okay.
It could be just the byproduct of the medication too. I mean, when you're using really super strong medications, you know, it's a little bit of a trade out for something to be slowed down. Sometimes it causes other problems, but again, make sure he's hydrated, and then do the peppermint, ginger, see if the Coke helps, you know, just not much, just like 1 can or something. And then let us know, because if not, we'll try to troubleshoot it for you. But at least knock those things off the list.
Which oil which oil or compress or something would help heal a wound of a dog? She had surgery, about 6 stitches worth, to drain a cyst, and it's almost healed but sticky, and she is on antibiotics.
I would just use tea tree for that. Just good old-fashioned tea tree. You know, put a little bit of tea tree on it, or put a little bit of a compress and tea tree on it. Help fight the wound. I probably wouldn't get the wound super wet unless you can kind of clean it from time to time. So probably just put a couple of drops of the tea tree on the site.
Those are the questions I had, guys. Thank you so much for everything today.
Thanks for joining us today. We're going to do more of this. We'll do another one next month where we do a free class on treating something. I'm starting to think maybe with everything going on, stress could be part of it, but we might go a little bit deeper on the immune system as well. So keep checking the site, and we'll let you know here shortly in the next week or so. So, and again, remember at the end of the month, 29th, 30th, is a free retreat spa weekend. So we're going to treat the endocrine system and have like a kind of meditation type practice ingrained in all of it. So, and to all the mothers again, happy Mother's Day.
And thank you again. It was wonderful.
You're so cool. Yeah, I'm glad you guys enjoyed. Thanks for joining us today.
Thanks, Greg. That was a great day.
Yeah, good.
Happy to see you again.
Yeah, good to see you guys, and thanks for joining us.
Thank you, Greg. This was
Thanks,
amazing.
Greg. Hey, Greg, I emailed you the what's in the balance blend.
Okay, perfect. I'll go through and look at it
you
and get
again.
back to you. Yeah,
Okay,
you bet.
take care.
Thank you, Greg. Namaste.
Hey, namaste.
Bye.
Bye, take care.
Bye, y'all. Have a great weekend.
Thank you, take care.
Is there an Star session tomorrow?
Yeah, there's still in a star session tomorrow, whoever asked. Yeah.
Bye, Greg and Sam. Thank you.
Hey, take care, take care.
And black cumin and black seed, is it the same?
Same thing. Black cumin and black seed are the same thing.
I'm going to ask this, but today when you mentioned after meditation, seeds come out sometime later. Today when you mentioned after.
Yeah, sometimes it agitates lower emotions.
In that situation, how to stay calm or handle a situation.
Yeah, the protocols that are listed there in the lower emotions.
And then can you please explain a little more about death and dying and 99 aspects of the heart, what we are doing in it? That's different things. I don't know what they want you to explain about.
I
death
don't
and
yeah,
dying.
I don't know what you.
And the vital centers and the 99 aspects of the heart are just I don't know how you want to explain that, but it's for the
Ne-
people who've taken the.
Yeah, the 99 aspects of the heart are tied to the function of the vital centers, and there's just 99 aspects of God that help to increase the expansion of the heart center. You know, tap into different aspects of God. It's very super activating to the heart.
And as far as the death and dying thing, you may have to email us more specific because I don't, there's okay. Thank you.
Okay. All right. Take care. Love you guys, and happy Mother's Day, and we'll see you sometime next week.
Yes.
Thank you, thank you, thank you.
You're so